of Monday, July 27, 2026 to order. We have a quorum. We have 3 members currently present. Just so anyone online can recognize voices, could everyone please introduce themselves?
Sure. I'm Bea Brunkhorst.
Maureen Rachichi.
Susan Schwartz, and just after 6 o'clock. So we will get started with public comment. But before we launch into public comment, I just wanted to make a statement. On our agenda today, we have a review of our regulation about the sale of tobacco and nicotine products. And I just wanted to clarify, this is not the hearing. This is really a review of an updated draft proposal. And if the board opts to move forward, we would have a hearing and also review it by town council and reach out to the local retailers. So today is really just reviewing the draft proposal to see if the board members have any changes they would like before we take a vote. And then if we take a vote to move forward, we would have a hearing. So I just wanted to clarify that. Heidi, did I miss anything on that?
That's perfect. Thank you.
Okay. So with that said, I'd like to open to public comment. If there is anyone in the room who would like to offer public comment or anyone on Zoom, if you could raise your hand. Thank you. If you want to come forward, if you could introduce yourself.
Yes, certainly.
And give your address, and you'll have 3 minutes. And Maureen, if you can keep track of time.
Thank you. I'm glad to hear there will be a public hearing on this. My name is Stephen Helfer. I am a member of Cambridge Citizens for Smokers' Rights. We accept no money from any source whatsoever. I want to speak mostly on the generational tobacco and nicotine ban, also known as nicotine-free generation. And I have 3 basic points. First of all, immigrants of color own almost all of the stores that sell tobacco and nicotine products. Now, if this prohibition goes through, this gradual prohibition, I don't think any of these stores are going to lose all their business, but it will certainly hurt them and it will devalue the business. Brookline merchants saw overall sales declines after this prohibition was put into effect. Again, proponents will tell you that none have closed, but these stores have small margins, and to be successful or to be unsuccessful is a fine line. Most of the proponents are doing this ostensibly to protect youth. If the tobacco industry is trying to attract youth, it is failing. Centers for Disease Control and Prevention reports teenage smoking is the lowest that's ever been recorded. That's a 25-year low. The Food and Drug Administration reports youth vaping at a 10-year low, and their use of nicotine pouches remains low. I believe this is a prohibition not on youth, but on future adults, persons 21 and older. Massachusetts residents 21 and over are free to purchase marijuana and alcohol, both of which are intoxicating. I believe our adult population is competent to make decisions regarding tobacco and nicotine, neither of which impairs judgment or compromises driving skills. Thank you for your attention.
Thank you.
We have someone on online. Emily, if you'd like to unmute and introduce yourself, please.
Hello. Oh, sorry, my camera's...
Emily, it's Susan. I just want to make sure you heard what I had said previously. You'll have 3 minutes if you can give your name and your address.
Yes, will do. Sorry about that. My video is been muted or un unshown.
Okay, you can go ahead and talk.
Okay, yeah, sorry about that. I'll go ahead. Yes, thank you. I came here tonight. I live in Cambridge, Massachusetts, and I came here tonight to say that I'm opposed to the nicotine-free generation proposal and to also ask about the possibility of having a public hearing. So thank you for clarifying that at the outset. While I'm here, I just want to say that I'm opposed to this because it's an illiberal policy that proposes to discriminate against different adults according to their date of birth. And the age to purchase tobacco and nicotine in Massachusetts is already 21. There's no need for this proposal, and there's no need for Board of Health in any local town or indeed any state or local government to put policies in place to discriminate against adults, different adults. This proposal is clear overreach by local health authority, and I'm really happy to hear that there will be a public hearing about this. And so thank you very much for that opportunity, and have a nice evening.
Thank you, Emily.
No one else online.
Anyone else in the room for public comment? Well, thank you both. And with that, I'd like to close public comment. And next on our agenda is actually Health Department staff reports. So who would like to go first?
I'll go first.
Oh,
did you want to go? No, go ahead. Oh, okay. I counted to 3. Nobody jumped. Okay, so I'll start off, as I always do, with the annual food inspections. We had 5 annual food inspections. And for some reason, we're in, I don't know, month 5 with the same violations, signs not posted, incomplete labeling, cold holding, and this was a new one, food stored on the floor of a walk-in refrigerator. These are just some of the violations. They're all, somewhat similar. But as I say, every time we have a meeting, we're going to be doing trainings and putting in some new processes and education for the food establishments. We did have today, it wasn't on here, but today we do have a food establishment that volunteered to self-close because their 3-bay sink is inoperable. So they're not able to sanitize anything. So
what's inoperable?
what's inoperable? They're a 3-bay sink, so
Okay,
they
yeah.
can't sanitize anything. So they had to temporarily close. Yeah. We have a pre-operational food inspection for cafe services at Wharfin, and that's on the agenda to ratify their permit. They were issued their permit on June 16th, and everything looked good there. Not much has gone on this month as far as complaints. Luckily, we did have 1 food complaint, and there was actually nothing. There was no violation that was observed. It was more that there was a thermometer at a meat counter and it wasn't registering properly, but it actually worked. All of their systems worked. It's just that they left it there because they had all of these other systems. And I told them, for public assuredness, you have to have everything, working. So technically it was a violation, but everything that was working. They have an alarm system. They have lots of checks and balances. So that ended up being okay. I'm working on temporary food event permits. I'm reviewing and issuing for the Bedford Beer Garden on August 8th. And just some complaint inspections for housing. There was 1 unit at an apartment complex that had numerous flies, and they weren't sure where they were coming from. There's a big investigation going on there. They're still not sure. So the house was immaculate when I went there, so there was nothing as far as the occupant having anything to draw these flies in. So I went actually for the inspection with the building department. We've been working a lot together. So, which is great because they were able to look at the vent system, which I wasn't able to look at, and determined that wasn't an issue either. So, yeah. They were.
I can just interrupt. That's another example of town departments working together for the betterment of the community. So I appreciate when you let us know that, because
Yeah.
I think it's important that the community understands we're not working in silos.
No
We're
silos,
Doing
yeah.
things collectively to
Right.
help the community.
Exactly, yep. There were 3 nuisance complaints. One was a neighbor was complaining that there was construction material, and they were worried that that might be a source of pests. When I went to the inspection, there were no pests and there was no construction material. It turned out it was an old hockey rink that was just waiting to be picked up, but when I went by, there was no hockey rink, so I'm not sure what happened there, but the other one was grass was overgrown and the neighbor was just worried about ticks. We know that ticks hide in overgrown grass. So I issued an order letter, and the wetlands protection bylaw and regulations state that one portion of their property actually should remain unmowed and untouched in their natural state. So that was another example that I worked with code enforcement and yeah. And then there was a food establishment that filed a complaint that another food establishment stored their inoperable dishwasher outside. So we got that taken care of. They removed that. Not much else though. We finished the pool inspections, the beach inspections. There were no animal bites this time, which is nice.
That's a good thing.
There was an uptick on that. Yeah. And I am going to a full day of septic training on Thursday. That's part 2 of 1, so that should be interesting. I don't have anything else that's of interest.
The only other thing is just what you had said, that the
Oh.
hoarding, everyone was making progress.
Everyone's making
So thank
progress.
you.
One person is almost ready
Good.
to be released from from the health department.
Right.
And I just want to tell you that item 11, it says see item 11 above. It should say see item 10.
We figured that.
Yeah.
I think we all caught
I wanted to let you know I caught that.
And it's good news that it looks like training for the food establishment will be at least by January, right?
Oh, absolutely. Yeah. It probably won't be until January, but it will happen.
Okay, great.
It's already in motion. We're
Yeah.
already working with Mogen and planning everything out. So it's not that we're waiting until then. It's just they have a new system and a new way that they would like to launch the training. So that's why it's
Oh,
January.
yeah,
Yeah.
yeah, makes sense.
Yeah.
No, and that's good, especially with the repeat violations and
Yeah.
also some of the basic things. It's just a
It's a
refresher.
lot of basic things. Yeah.
Any questions?
No,
Thank you, Marisa.
Thank you.
Thank you.
thank you.
Hi, everyone. Hi. So number 4, partnered with the police department and CERT to host a cooling center at the police department in response to the extreme heat watch issued by the National Weather Service. The cooling center was open from Wednesday, July 1st to Saturday, July 4th from 8 a.m. to 8 p.m. On the health department's end, we developed outreach about the center and published general heat safety tips. And the police department and CERT have been great partners. It was great that we were able to offer a cooling center from 8 a.m. to 8 p.m. and especially on a Saturday. So the police have been really awesome with allowing their training room to be used, because that's really the only place that's open the most and has
Right,
AC.
right.
Do you have any
Prices.
data or numbers on residents who?
Say at least 1, maybe 2 or 3
And-
throughout
but
the
then-
time.
Okay.
And people brought their pets, so that was an additional person,
Oh, good.
additional being there.
Great.
So that ended up working out well. Number 13, met with Kaylee Watson, Great Meadows Shared Services Coordinator, and Greta Stanier, Health Department intern, to discuss how to analyze Ashby Place interest survey results. As part of Greta's project, she issued a survey to Ashby Place residents to see what they would be interested, if they would be interested in the Health and Human Services Department coming quarterly, monthly, every other monthly. We're getting the schedule down. To have health talks or really just like social events. Because I think the Health and Human Services Department, I know one of our passions is combating loneliness and promoting social isolation, because that's a huge issue. And the survey had Greta pass out 80 surveys. She went to every apartment and put a survey under the door. So people were able to do a written survey or they could call. So trying to get everybody, so it wasn't just online or using QR codes and then in different languages. So trying to get access to everybody, and 41 people answered. So
Whoa,
over
that's wonderful.
50%.
Isn't that amazing? Whoa, that's great.
So it's a great,
That
and then
personal touch, right?
Mhm.
Delivering it
Yeah.
right to them in an
Yes.
easy format. Yeah.
Yep.
Great.
and got some great responses of what people are interested in. It seemed like there's a lot of interest having a blood pressure clinic, so I'll
Okay.
rotate that in as well. So I'm going to meet with Chris, Mallory, Kathleen, and then Greta as well to go over next steps. But it was very successful and she did a very good job.
Yeah, if I can just interject, I attended the social that was held last week.
Yeah.
At Ashby Place, and they so appreciated the survey. They really, the residents that I spoke with, so appreciated that their responses were read and being actioned. Because Greta did detail some of the responses,
Mhm.
and people were taking flyers about HHS and everything. It was really a nice event. So thank you for, for everyone, and especially Greta, for reaching out and then following through.
Yeah.
The residents really just wanted to be part of the community.
I didn't put this on my report because I did it after I submitted the report, but last Thursday we did have a social.
Okay.
And I think about 24 people came, which was really great. We had food. Greta gave a little speech on the survey results. I introduced everyone who was there in the Health Human Services Department. We made outreach. And Chris did a nice talk on SNAP benefits because there were people asking about that.
Good.
So it was really good. And we raffled off. We did 5 different raffles and that got the crowd going. So that was really fun. But it seems like there's a lot of interest in continuing, even just like kind of social things. I do have a typo in number 16. International Overdose Awareness Day is August 31st, not August 1st.
Okay.
So last year I went before the select board to ask if we could put up a flag display to represent the number of opioid related overdose deaths that occurred Middlesex County from 2023 to 2024. This year, hoping to do the number of deaths in Massachusetts. Luckily, the deaths have decreased, I believe, by 30% in the last year. And we were hoping to do it actually in the police department lawn this year because it's a little easier to see.
Yes.
Last year, I didn't take into account the fence in front of the town center, so you
Oh,
couldn't
yeah,
see it
yeah.
from the road.
Right.
The flag's so small, and then we put it in front of the fence, so if a car was parked, you wouldn't be able to see it. So this year, we're hoping to do it in the police department lawn. Chief Amendola has been really great, and he said he would love to partner on it, so I just wrote to the select board. I don't have to go before the select board, it's on the silent agenda, I'm forgetting if that's the exact word.
Consent agenda.
Consent agenda, yes. And then hopefully should have an answer if we can or can't do it in August.
Okay.
And then I'll be working with Youth and Family Services on that. Number 17, posted a blurb to HHS Facebook and Health Department website about air quality. And I added a page to the Health Department website with a link to airnow.gov. So if you go on the left side and you click air quality, it goes right now to airnow.gov. We were just getting, understandably, quite a few calls when the air quality wasn't too great about what the Health Department was recommending to do. And since we follow the recommendations of like the state, and and it kind of depended hour to hour how things were going. So the airnow.gov shows you in real time what that hour the air quality is and what actions do for that hour.
Oh, wow.
So it's great for people who were coaches who are calling about lacrosse practice. Should they still have lacrosse practice? I directed them to here, and then they can make a decision, and then they can, tell the parents all about airnow.gov, and then the parents can make an informed decision about if their child has asthma, if they feel comfortable in playing. So kind of giving a resource to make
Oh,
hour by
yeah.
hour decisions.
Yeah,
Wonderful.
the airnow.gov also does nice forecasting
Mhm.
as well, so you can kind of look ahead.
Oh, great.
Oh,
What
nice.
they anticipate. It's not always right, but it gives you an idea.
Yes.
And I heard from residents that they appreciated some who have compromised lungs and being able to figure out what they can do now and in the future.
Mhm.
Very helpful.
Because what they called out 11 could be different by 3. So
Right.
it's a really good resource. So I put that there. So you have any questions about my report?
Not a question, just back to number 12. I just want to let the other Board of Health members know and residents, what an amazing job, Jackie, you did on setting up our social media for the gun violence prevention.
Yeah.
We look forward to that campaign coming out, but how nice it looks, the information that's there, how comprehensive it is due to Jackie's work. So thank you.
Oh, thank you.
I'll echo that. Thank you.
Okay.
Thanks.
And we'll talk about it a little bit more when we go
Yeah.
through the goals,
But
but
just in the
while
report,
you're
yeah.
here and going through this, it's important.
Oh, thank you. And then for the communicable disease table, just looking at FY 26, all the numbers were pretty much the same communicable diseases popped up and around the same numbers as well. The biggest difference was COVID, and we had 100 less cases than the year before, so that's good news.
Mhm.
But other than that, things seemed relatively the same,
Okay.
and the same trends for
Hmm.
tick-borne. And we'll see how the tick-borne fares when it comes up to this July, August, and September. But so
Yeah.
far, I think it's going to end up being different for the next fiscal year. But just for this.
Now, I thought I saw something where you were saying that you wanted to change the reporting.
That's coming up.
So-
Oh, it's coming, okay.
Yeah, so
Oh, that's
I was
okay, never mind.
wanted to, just a suggestion or just something to think about. We don't have to, of course, decide right now. But I just wanted to, so this table that we have right now doesn't necessarily cover everything that I investigate per
Right.
month. So I don't think right now it's covering everything. So like, for example, enterovirus group B streptococcus, H influenza, legionellosis, Powassan virus, and then latent tuberculosis are not on this chart. And those are some things I investigated last year, or if I didn't investigate, at least popped up. And latent tuberculosis isn't infectious, but I did want to just mention that because we had like 26 latent tuberculosis cases. And it is something that takes effort on my end, and
Mhm.
just so I'm communicating what I'm spending my time on.
Yeah, yeah.
And then I know some other towns in the region also report on the latent tuberculosis, so I just wanted to put that out there just because it is a.
Yeah.
So I don't necessarily know if we want to, just trying to think about how to make it more accurate for the diseases that are communicable
Mhm.
diseases are popping up. So just trying to think about that. And then for the reporting on suspect, probable, and confirmed cases, so this chart is confirmed except for Lyme, which we do probable or suspect as well, because there's not a lot of confirmed because the lab testing is different.
Yeah.
And the other towns also in the region report on suspect, probable, confirmed for everything. I don't know if we have to do necessarily that. I was thinking for foodborne illnesses, it might be a good idea because sometimes it's just the way the lab reporting is. So for like Campy, for example, for it to be a positive result, it has to be a culture. But not everyone does a culture. It's something else, but the provider still has diagnosed them with that. They're on antibiotics, and I investigated. So it's kind of a little
It's
nuanced
artificial,
in that
yeah.
way.
Right.
Just kind of something I want to put out there.
Sure.
Just
I have ideas on it going forward, but I'll go around first. David, anything? B.
Well, I just say that I love data, so I don't want to lose this. I mean, I really like to see, the trend over the last year. So I really like that. I love your idea of adding more things. So I'm definitely a proponent for adding more lines, but not take away the columns.
I agree with B. I really like looking at this, but from my own work as a public health nurse, I know there was a lot you end up doing that is not reflected in what's reportable. So I would really appreciate knowing. And it's just not what you work on, it's for us to know what's going on in the community too. So that would be great. Thank you. However you want to configure it would be helpful.
Okay, so I have an idea and I'll put it out there to the group. We have a number of rows that we have nothing. So my thought was start with what we have.
Meaning what ones are.
Oh, to
confirmed.
sort in terms
Yes.
of
Basically,
amount
just
instead of
list the ones. And so if, let's say we started with the beginning of the fiscal year, go back to July, I guess, and maybe do June, just so we know how we ended the year, and just put the illnesses that we have. And then each month, if we have more, just add those illnesses. So some that we really never have, wouldn't be shown
All right,
Okay,
unless
so
they
yeah,
occurred.
the main
unless
thing
they
is,
occurred.
the main thing is that it's not more work for Jackie, right? So you're saying to sort, based on this fiscal year that we're just ending, in terms of the order. And then after that, you just add things, but it's gonna be a bit of, I mean, it depends what you wanna do,
Yeah,
Jackie.
because
right?
I guess I'm not saying a sort. I'm saying just list
Listing.
anything we had in this past fiscal year. So that would automatically get rid of
Mhm.
a handful.
Mhm.
And then if we encounter one,
Add
add
it.
that as a row. So we'll always be sorted alphabetically. But let's say we never have,
Viral meningitis.
right, now that's exactly where I was looking.
Which one? Oh.
Viral
Meningitis,
meningitis, if we
yeah.
don't have one, just take it off the report. But if we have one, then add it alphabetically where it belongs.
Well, the thing is, that I still like the awareness that we are monitoring all this stuff.
So
Oh, but she's,
on that note, what I was gonna suggest was we basically just essentially have almost like a footnote at the bottom saying the
Yeah.
following case, diseases are tracked and have had no reported cases within the past fiscal year.
If we want to do that, the list would be much longer. So like if we want to cover everything that's covered in all of Maven, it would be much like measles isn't on here, for example. Measles
Okay.
isn't on this mix, so like
Oh, wow.
that's where it's kind of a little
So
bit
why-
rushed.
I guess my question then is why are there ones that are on
Maybe
this
there was
table and
something
why are
there
This
there?
is what this is a list I inherited.
Right.
Okay.
Okay,
Yeah,
so
so
at
that's
some
why I'm trying
point it
to-
was
Because like
reported.
measles isn't on here, and like they're just I don't know what, like some are here and some aren't, I guess.
Mhm.
So it's like if we did the whole Maven list, it would be
Okay.
probably triple.
Then I
And
think
Yeah, no, but that's what I was thinking too. I was just trying to think of how to make
Well,
it.
it's kind of interesting. I mean, you might want to do a little homework and just see, is it like that it was reported in the last 10 years in Bedford? And if it wasn't, then take it off and then just you're down to that same footnote idea. And instead you qualify it, well, these were reported in the last 10 years, but not in the last fiscal year or something.
or can you just supply us with the list of all the reportables? And the
Right.
ones that you think you're gonna watch for, whether they're reportable or not, that you think it's helpful for us to know, so we have that as a reference. And then it doesn't have to be listed every time.
Right, you just
Yeah,
you
that's
give
true.
that to us once.
And give
Yeah.
that to you once, yeah,
That'd be good.
yeah.
I don't mind doing it. It's not that. It's just trying to make it more
Yeah,
like
make it
accurate of what we're
realistic,
looking
yeah.
at.
Yeah.
So,
Accurate.
but I can make a list of everything that Maven tracks, and then I can do add as we go. So it's
Right.
like that's what add as you go was I was thinking too.
I recommend we try that, and then we'll see if it's
Yeah,
not
let's
working
try
for
it.
you or for us, then we'll.
But
And
I
it's,
think,
it's whatever works for you guys. That works
Yeah.
for me.
but
I
I
just
think
want.
whatever occurred this past fiscal year, we start with, because that gives us a rolling.
Is that
I
long
think
enough
so.
though, from your professional opinion? Just the
For a
last
year?
fiscal year, is that long enough? For you
For
to-
the chart,
For you,
A long
yeah.
enough look back, a long enough look back. is what
Yeah.
she's
I could
saying.
do the 10 if that's
Well, or we could just say, if it looks like, say, something like, I don't know, pick one of these, and all of a sudden we see an uptick in it, we can ask Jackie to get us the data history.
Yeah.
To look at the trend. If you see it, then bring the trending information with you to the meeting, but otherwise, I don't know that we need to,
Yeah,
yeah.
yeah.
'Cause we
I just
are
wanted to make
getting
sure,
us-
like, if you use this as a tool for something, then I don't want to mess you up.
Oh no, won't mess me up.
Okay.
Yeah.
All right.
And this is just a subset. I think going back, we just came up, I think it was during COVID, we came up with just a list that we wanted to track in addition to COVID.
Mhm.
So just wanted to.
Okay.
But whatever, to everyone's point, whatever works for you, where if we need the history, we can always pull it.
Oh yeah, and I'll put a list together, and I can put some histories together and email to you guys. See what you think.
All right. All right. Thank you.
Thank you.
Thank you.
Any other questions
No.
from your report? No, thank you both. Heidi,
Okay, so we have our regular monthly meetings from the with the hazardous waste, household hazardous waste collaborative. And we've been having a little bit of trouble with technology over the past couple of collection events, so we've kind of reverted back to just the paper and pen and trying to collect the data that way. We are not in charge, the town of Bedford is not the seat for the technology or for the, you know, management of the event. It's the city, the town of Lexington. And they were trying to help us over the past couple of years establish this process of an online database software system and using an iPad. So thankfully, we do have the backup systems. It does, however, result in some longer lines at the event. So kind of working through that and hoping folks, you know, that might be listening, or we're just trying to get word out that, you know, hoping that people be patient as we kind of work through these technological snafus. But everyone that shows up, that makes an appointment, you know, has their waste disposed of. So the program is working really well for us. We are in the process of having to go out to bid for a new, or for the next vendor that we might have. It may be the same vendor, but and deciding whether or not we would actually purchase those services off the state contract list, which is a listing of approved contractors, or actually just putting an RFP out there to go out to bid. So we'll be hearing a little bit more about that as we move forward into the next couple of months or so. We were fortunate to have, we being Carla, our food bank coordinator, and myself, we're fortunate to be able to have a meeting with the town's contractor, MAPC, as they pursue the next steps for the and future use of the current fire station, the old fire station at 55 Great Road. As you know, the fire department will be shortly moving into their new digs, and trying to figure out what the best use for that building might be. We've all along thought it might be a nice place for the food bank. Other departments also have a feeling for using that space and ideas as to how to use it. So, but we did want to sort of be able to make our, sort of our presentation to the consultants that were gathering that information. And I know there's going to be some community events, virtual and as well as in person in the coming months for folks to be able to weigh in on, residents to be able to weigh in on that as well. I have renewed some of my professional trainings. This is the time of year where sort of those renewals are due. So it's a matter of, little scrambling to get the CEU credits in the middle of getting all, all of our other good work done, but continue to maintain my certificate as a certified professional in food safety. And annually, then I also have we have a registered environmental health specialist and a couple of other credits credentials that pop up over the course of time. I know Jackie has some as well. Maurice is working towards some. So it's part of the work that we have to do in order to do the work that we do. So maintaining that education and credentialing. We did receive word that our in-house therapist that we have through our vendor, our contractor Edinburgh, is going to be leaving us. Unfortunately, we had some really great run at it. Little under a year with Ainsley. She's really been a great contributor to the department. She's moving on. I have a meeting with Edinburgh tomorrow. The management there to talk about next steps. They're already posted the position, so we're hoping that there's not too much downtime. The beauty of working with a vendor who has a presence in town is that any folks that might be in crisis or might have some more immediate needs will be able to be seen at their clinic on Burlington Road.
Okay, great.
So we hope to not have too much of a bump in or a gap in services. Obviously, our social service team is still fully operational, so we'll be kind of working with residents as much as we can, just short of providing therapeutic services. But should that need arise, again, we have our partner in Edinburgh who really have been fantastic with working with us. And of course, in the middle of it all, we had a resident that was in crisis, so we had to give her access to services, and the whole team worked together on that. And it was really, again, it's so heartwarming when you think you get the call, but then you already realize others are already kind of have either received a similar call or have worked with an individual, and we have the opportunity to have those conversations and discussions because we have meetings all the time and we're talking about cases or at-risk cases and services, and we kind of have a packet that we can just roll out to an individual or have a path for folks who do present that have very specialized needs or need access to resources that we can help facilitate. So always heartwarming on that end. We were able to do some outreach on this really neat program that we kind of stumbled across, and we were surprised that we hadn't heard from the SNAP program on this, but it was EBT Cards to Culture program. So we did some outreach to our food bank clients and through our website, just around for folks and community members who hold an EBT card. You actually can get free access to many cultural programs, museums, and just meeting places in and around the area. There's a whole section just for Metro West area, but you can look and go even broader than that. The website is really great about it being maintained for that. I actually looked to see if there were any Bedford specific, and I did reach out to our Eric Salerna, who liaisons with our cultural council. And it wasn't anything very specific to Bedford, but it was just kind of interesting to think about like what they might be able to have, what we may be able to have as part of that program in the future and think about. But being able to roll that out to our community was really a nice thing. And really last month was a lot about, buttoning up our fiscal year 26 budget, making sure that everything was balanced. Danielle did like a fantastic job in making sure that all our purchases were made, our invoices were in, any monies that needed to be encumbered were encumbered. She is a crackerjack with our budgets. We maintain we have our really great Munis system, which is the townwide system, but we maintain our own checkbook to have checks and balances. And she and I work, go in and out of that to make sure that we're on track with our spending every year. We know when vendors are coming in and the invoice is going to hit like at the 29th of the month, when we know that, we have to make sure we account for those funds to be in the budget to that period. So about balancing that budget, but as also having that historical knowledge and institutional knowledge of how the department runs. We have a great team, and couldn't do it without all these fantastic ladies that we work with, and our great interns and extended HHS family. We all work really well together, but Danielle is that, like, everything funnels through her, and she's able to make those purchases and have all those connections and keep us on track. So a little bit of a sigh of relief now that the calendar has turned and we can start digging into our new budget for this year. But really fun to have access to now really have some really great data from the regional collaborative, which is our safe, not our Bedford safe, but our Great Meadows safe, which is our substance use prevention programming. We have all the great survey results and the results from the listening sessions. So look forward to rolling out some good programming along the lines of sort of the upstream. And we've talked about this, that we hope to do some upstream programming, like with youth and folks, and doing some prevention work within the community. But really acknowledging, because we heard this from folks with lived and living experience in our communities, that they're looking for that niche help during that time where either they're coming from rehab or they're just out of a rehabilitation program, and they need those supports, like a sober living environment. So maybe offering scholarships for sober living experiences, help facilitating finding a place, places to live and safe places to live so that they can maintain their sobriety. We've learned a lot about the supports, and the lack of supports that are out there. So trying to pull as much as we can. And we're realizing that the power we have working as a region again is tremendous, because we couldn't do it alone. Although we have a decent amount of opioid funds that we're receiving from the settlement, the power is so great when you work from a regional perspective, and you have so much more that you can access and take advantage of. So looking forward to being able to share some of those findings and proposals with you in the future.
Great. I was going to ask about that.
There we go.
I'll just go around. Maureen,
No
anything?
questions.
Further right now.
David?
One question on, you talked about with the food bank with the fire station.
Yeah.
Do you know, and I'm sure this is all going to be things to be hashed out, but if there's any concerns with contamination from chemicals and things like that are used?
It's part of the proposed funding for the rehab of the space will include all of that. It'll be a full eval of all of that for sure.
And I actually attended the virtual session, and it's posted if anyone wants to listen to the virtual session. What was pretty cool is they had you scan a QR code and they asked polling questions throughout the session, and then reviewed the feedback. Plus they enabled people to ask questions via chat.
And they'll be in September or October. There's an in-person.
Right.
Larger
And this is just the first of, I think, many.
Yeah.
And there were lots of ideas for use. But some of the questions were, like contamination, also who makes the decision, where's the money coming from? There were lots of questions along the way as well.
What's the timeline for the decision?
No, I didn't hear that was mentioned.
They
I think
gave a
have to figure
timeline
out-
in the beginning, but I don't think they got it to the end then. But
Yeah, just starting now.
I thought I had read somewhere in the Citizen that it won't be until they move that serious consideration is given to the space. Because I think what
Makes
Harry
sense, I
alluded to,
mean-
somebody has to go in and assess the space in terms of safety and what would need to be
Yeah.
rehabbed.
Right,
Aside,
right.
Any
Nice
other?
just to have a ballpark, but anyway, yeah.
Any other questions? The only thing is I want to echo what you said about Danielle, and I loved in your report where it said all budgets balanced out. And I thank you
Yay.
to everyone who made that happen, because that is huge.
Yeah, that is huge.
And it helps for the next time we go be in front of Finance Committee asking for money when budgets do balance out.
Yeah.
So thank you.
Yeah.
That's it from staff reports. Then next on the agenda is a new food establishment permit ratification for the cafe services in Worcester. Do you want to come up and join us?
Absolutely.
Let's take a seat up there. And welcome.
Thank you. Michael Lewis, representing Cafe Services. I live in London, New Hampshire.
Okay.
I'm the VP of Safety and Operations Support for Cafe, which is a small regional contract management company like the Sodexos, but we're just small regional. We are from Maine, Virginia now, and we have one account out in Michigan. So, right, all we do is exclusively is corporate dining, like a Werfen, things like that. So we have some multi-tenant businesses that we do. But yeah, that's what we do.
All right.
We're happy to be in Bedford. We've had one for a while now in Bedford at 4 Crosby Drive.
Okay.
Okay.
The, I think, iRobot building.
Yeah.
Yep.
Yeah, it was, used to be Bedford Business Park,
Mhm.
so.
That answered my question. Do you have any other presence in town?
Yes, we do.
Yeah.
Yeah, we've been
Krista,
there a while.
anything to kick us off here?
Nope, as I said in my, my report that they received their permit from us on June 16th. They were in in good standing. Well, that's hard to say. And there were minimal items to be corrected. We don't call them violations because they didn't have a permit yet to violate anything.
Right.
So minimal items, and it looks amazing in there. Sanitary, they're good to go.
So do you serve lunch, breakfast, dinner?
We
what?
do breakfast, lunch, and there is a PM grill, I think, to 7 o'clock,
Oh,
or
okay.
6:30. Yeah.
And the employee count in Werfen? I'm not.
I
don't know
want
how
to
large
say
it is.
it's between 1,200 and 1,400.
Wow, okay.
So I think it does vary.
Yeah, busy, yeah.
How large is your staff?
We have 14 on staff. So we have a catering manager, catering chef, executive chef, sous chef, utility person, salad bar, deli prep. Yeah.
Okay, wow.
I have questions, but B, did you have any before I go?
No, I mean, how long has your company been in business?
I believe we just had our 30th anniversary.
Oh, wow.
Oh, okay.
Yeah.
Awesome.
So I've been with them, be 24 years next month.
Wow.
So
Just Monday through Friday?
it is
or-
just Monday through Friday.
Okay.
Yeah. I don't think we do anything on the weekend for them.
And only for employees and guests?
It's only, yeah, only for the people in the building. Yeah.
Okay. And you said breakfast, lunch, and like an afternoon?
We have
meal?
a PM grill. I think it goes from like 3 to 6:30, I believe, something like that.
And how early in the morning?
I think we open at 7. Yeah, our staff is there anywhere between 5 and 6. So I think we open for business at 7.
That's really a nice
Mhm.
comprehensive.
Yeah, and they take very good care of their employees.
Okay.
Our prices are very low.
So they subsidize?
They
That was-
subsidize,
okay,
yeah.
That was gonna be one of my
Yeah.
questions, right?
I think an average entree is $5 or $6.
Okay.
Sandwiches are 5 or under, and it comes with chips, fries, a cookie. I mean, yeah, they take very good care of their
Okay,
employees.
And they have the new parking garage right behind the building.
Yeah.
yeah, so.
I haven't parked out there. I only park out front of visitors, but
Yeah.
yeah, it's a very nice operation. They seem to be a very nice company to work with. So
Wow.
Any questions from anyone?
No, I think mine were answered. Do you have any?
No, I would just say, like, it's nice that you have another location in Bedford, because then you know how Bedford operates.
yeah, it's been, you guys have been great to work with. So
Okay, good, good. Well, we're glad you're here. We're glad you're here.
thank you very much.
Anything for the two of you? I'd entertain a motion if someone
I'll
wants.
make a motion.
Mhm.
I move that the Board of Health ratify the permit to operate a food establishment for cafe services at Werferen at 180 Hartwell Road that was previously issued by the Health Department.
So moved by B and seconded by David. All in favor?
Aye.
Aye. Any abstentions? Any no's? I think you're good to go.
Good.
Awesome, thank you very much.
Thank you for
Thank you.
traveling
Have a
down
great
too.
evening.
Thank you.
Thank you.
Good luck.
Thank you.
Nice to see you.
Next on the agenda, and I just want to make sure, at the beginning of the meeting, I clarified that public comment and what we're doing today is I'm going to go through the draft update to the regulation. It's not the hearing. It's, right now, it's really just reviewing an updated draft of the proposal to see about next steps.
Mhm.
So with that said, next on the agenda is to review the tobacco nicotine revisions. And Pari, do you want to come up? That way you're just closer to us.
That's okay. I'm always close. Good evening.
Good evening.
Hi.
Good to see you again.
Nice to see you
Yeah,
again. Welcome back.
Nice having you.
So, my thought, if it works for everyone, I just want to put it out there, is like we did last time, is we just go page by page.
Yeah.
And then we can see if, this is something we want to move forward with or not. And then we can talk about what the next steps are. Does that work for everyone?
Sounds good.
Sure.
Okay. So with that said, thank you for updating.
Welcome.
Any comments on, why don't we go, what's your first comment or question? Mine is until page 7.
Yep, I have nothing.
Yeah, well, the first few pages are
Yeah,
just
just
really
the-
updating the references to make them more current.
Definitions.
And, you know, giving you those resources. So that's what takes up
Yeah.
the majority of that.
The footer would just be changed to be the version and the date.
Yeah.
The only thing I have on that page, it's picky, but it's
Which-
just for
what page?
consistency, 7. 17.310, should distinguishable be underlined?
Yes.
Okay, just consistency. Otherwise, the content
Oh,
is fine. Yeah.
yes.
Thanks.
Okay,
So are you still on 7? or are you-
yeah, what I had on 7 was 17.3.6. And it may be just a formatting note, but at least in
Oh,
my
it's
print,
twice. Yep.
it has tobacco leaf in such kits or roll your own packages. All of that is duplicated.
Yes. I forgot to say that, yeah.
Yeah.
It's listed twice,
Yeah.
that statement. Okay, we'll take that out.
There's a one-word difference. Just says in such kits in the initial, and then what appears to be the addition doesn't, just says in kits. But otherwise, it's.
Yeah. So whichever way it should be worded, it should only be there
One.
once.
Yeah.
Okay.
Good catch. Page 8, does anyone have anything?
Oh, the green thing, why is it green?
Well, print it on my own, we don't have the green, okay. It's just, was added, right? That's what it means.
Yeah, Pari, for some reason, I mean, in the updated regulation, we talked about opticians and optometrists, like,
Oh,
was there a
yeah.
reason, like, why is that? Why
No,
is that added in?
basically, they have included the dental care or optometry under healthcare institutions.
Okay,
So that's
just
a,
to clarify that
just an
they're part of
addition.
healthcare
It's
institutions.
new.
Okay.
basically this is made from the MHOE model regulation, so we have not added anything new from our side.
Okay,
Can you just read, because maybe I missed it, where the part that's, it says exempted from the state law, but may be included in local regulations. What's that? Because it didn't come out in my copy.
Says a retail establishment provides
And then it goes to
optician,
retail, the whole highlight.
optometric or hearing aid or audiology services, but is not subject to regulation by the Board of Registration and Pharmacy, shall not be considered a healthcare institution.
So would that be in our regulation or would that be removed?
It depends what the board is deciding to accept it or add to the regulation or not. You can decide on that.
Right, it's just a
It's
matter
an
of
option. It's
definition.
an option given to the board. It can
Okay,
be said
so
or
that's
not.
something we have to decide.
Right, so
Okay.
I'm going to pose it to people. Is that something we would want or not?
So I guess it would be good to remind.
it seems very
ourselves.
specific. Do you
Yes.
know, Hari, why that was pulled into?
Yeah.
I mean, there were optical stores that were selling tobacco?
No, this is based on the model regulation.
Okay.
Just got added into it. We didn't go
Just
through.
to clarify, it was
Healthcare.
added into to make a clarification.
No, but I don't think we have any such thing like that.
Yeah,
I
Like,
guess we just need to do a search of where healthcare institution
I don't think we
is.
have any retail closer to any of these premises.
Just, I'm trying to think what it would be, if we were to remove that, because it seems a little confusing.
Yes,
So
it
do
is.
you
And
know,
if it's-
Perry, where healthcare institution is listed in the regulation?
The definition, it is there, otherwise.
Right,
Right
but
here.
where is it, where does
Um,
it play a role in there?
If you see in 17.818, it is what it is in mine, prohibition of the sale of tobacco products by healthcare institution.
So, I'm sorry, which one is that?
It comes under
Did you say 17.8?
17.8, did you say?
17.18. It's in mine, I think I'm having a different copy. Comes after,
no, 17.18. Yeah, it
Yeah.
is 17.18 is
18.
prohibition of the sale of
Oh,
tobacco
okay.
products by healthcare institutions.
so the healthcare
Okay.
institution definition is here, which
Okay.
includes all those institutions, like,
Okay.
So it's already prohibited at opticians and optometrists or in drugstores.
Right. That's already there.
Oh, this adds hearing aid, audiology services.
Wow.
we
I
can
mean-
remove it.
I don't know whether we need it.
Yeah, I don't think we may remove it. It's already included in this, so.
Yeah,
Right, so are you saying the part that is shaded, we would remove?
Yeah.
Okay,
okay.
all right.
And the blue.
In the blue
section
section,
before it,
yeah, the blue
Because
exemption.
that's referring specifically to that.
Right.
Shaded area.
Yeah. So we'll keep this definition of healthcare institution as is.
Right.
Yeah.
Okay,
Yeah, that's great. Thank
So
you.
we're taking out healthcare institutions include that sentence? We're
Yes.
leaving that in, okay. All right,
yeah.
No, we're leaving that. We're leaving healthcare institutions include but are not limited to.
okay,
Right,
so
we're
just
getting rid of
removing
the
the exempted.
exempted.
Exempted from
Exempted,
state law.
Right,
Okay.
yeah,
Yeah.
the blue highlighted and then the green highlighted.
Okay, I
Yeah,
copied
sorry,
it at
I'm
home, so I
sorry,
don't-
yeah,
Yeah.
so from exempted on will be stricken. Will be
Okay.
Strucken.
Stricken. Goodness, I need some language.
removed, okay.
Okay, page 9.
I don't have anything.
Anyone? The only thing I had, and it might be because we already appoint as our agent, but it says that note that the manufacturer's documentation is not conclusive evidence. A board of health may conduct a smell test. Is it a board of health or its agent?
We could include that language,
Yeah, I like
right?
that.
Hari, would you,
I like that.
well, who would be doing that? Sniff test?
Technically, as per the guidance from the MPCPTAs, it was the Board of Health doing the sniff test. But most Board of Health in our collaborative are having a quorum of members for doing the sniff test. one member from the board, one from the health department, one myself like the agent. So it's like a quorum what others are doing. So the board can have a quorum like that, because if I do a smell test, I may be biased, or it depends upon, I don't want to, what to say.
So then we need to have a statement in here about, in that statement, in Bedford case, it would include the following people, right?
Right.
Yeah.
We need
We
to
would need
We
designate
to
can add
say,
that,
the
yeah.
designees, okay.
Yeah.
so it could say a Board of Health may conduct a smell test, blah, blah, blah. And that's it. This test would be conducted by a combination of Board of
Yeah.
Health, Health Department staff, and its agent.
So it could just be, do we have to have the statement that a Board of Health, can we just say the Bedford Board of Health may conduct a smell test to determine if a manufacturer's documentation misrepresents where the product is flavored and shall consist of a committee of or the following.
Or shall appoint a group of
Oh, shall
Yeah,
members to
appoint.
how,
decide.
however we want to do it, but I think we need,
Sure.
Clarification.
We have to clarify that? Wow. So we can't just say Bedford Board of Health and then leave it up to us who does
I
it?
think it possible, if we don't clarify it, then people could challenge and
Yes.
basically say, does it mean we have to have the entire Board of Health? Does it have to be a quorum? Does it have to be, you know? I
The
think
thing
by-
is that, I mean, typically when you, well, let's just go back to the definition.
Yeah.
So if we look at the Board of Health,
It's not. in the
definition. is there a definition?
No,
No,
it's not.
Oh,
It's
there
not.
isn't.
No.
Okay.
No, that's
All
why,
right.
that's why I think it does need to have some clarification to what.
So what do
even
you
if it's
think?
just the Board of Health's designates, you know, I mean, it just
Yeah.
says that
Agent
it's
or
not.
designate?
Hmm.
Yeah, okay. Yeah. Because I don't think we know exactly who.
could we say a Board of Health? How about instead of A, we could say the Board of Health and its agent, parentheses S, may conduct.
But it's not
They're not all gonna be agents.
just agents, it's gonna be, you guys, it's you, two- it's a representative of the board too, is what Pari's suggesting.
So I think we're gonna just say the Board of Health,
And or. its
And
age-
or
And
its-
or and a committee of its agents.
Right, because you would be an agent and you would be an agent. So I think
But
it's.
it's not gonna be the entire Board of Health though, that's the whole point we're saying, we
Right.
need
But
to have it.
has a Board of Health person ever done such a thing?
No, but this is.
We've never
new.
done
This is-
this.
No, it's not, you haven't, but in other communities, this is what's happening. In order to
Okay.
decide, because there's so many products that are coming out, the suggestion is that it's a representative of the Board of Health and the committee of the agents.
Okay.
Yeah, so I think it's a representative of the Board of Health and a committee of its agents.
Okay, good.
And
may
you guys will
conduct,
just decide who that
may
is gonna
conduct
be.
a smell test. We
Yeah,
can make it on
right.
the first sentence, right?
Yeah.
Okay. Do you want to say two agents? Specific, or just,
Well, we don't know.
well, he suggested
many
three. He said
agents?
one needs to be.
Oh, 3 people?
One needs to be a
Minimum
regional,
three, yeah.
one
Right,
needs a
because
Board of
they have
Health,
to
and one
be-
needs to be a,
Yeah, I would want an odd
I
number.
would name three. Well, it's a member of the Board of Health plus two.
Wow.
Right, so it's
Yes,
three.
three, right. So if we're saying, starting with a member of the Board of Health and two designated agents?
A represented, a representative of the Board of Health and a committee of its agents.
I think you don't have to say committee, you can just say, and two
Two of its agents.
designated,
And-
two designated
And two
agents.
designated agents.
Okay, yep.
Okay,
We'll say may conduct a smell test, we're gonna say it
Correct.
right there.
all right,
To determine
Yeah.
everything else.
okay.
Yep. Okay, page 10.
So in the final version for 17.3.24, would we just strike the, whatever the
The
notes are?
notes are, because it's really just saying to
that-
see page 11.
Yeah,
Yeah.
so that would be,
Okay.
that would be struck in any future.
Oh. Yeah. Okay.
Right, Pari, that's just in there for the board's information,
Okay.
I would imagine.
Yeah.
Sure.
Anything else on page 10?
Did you have anything?
No, nothing else on page 10, then page 11.
Mhm.
Okay, so I'm gonna start with this one, you guys. The way it's worded right now, I would be 20. On January 1st of 27, if I was born in 2027 or 2007, I'd be 20 years old. It needs to be 21. So it would need to say
2006.
2006, but then we also have a problem still with what to do with January 1.
Well, it says born on or after.
But in the next sentence, it says before.
The next one says
No,
feel
right
born
down
on.
here.
Honor,
Oh,
That
the
was a
last one.
typo. I think
Yeah.
we need to,
So,
yeah.
I have it born on or after. Where does it
yeah,
say?
I was gonna say, I see.
I see
born
this,
on
their
or
minds are all fine.
Yeah. It says
Born on-
or
on or
after.
after, and then, but if you change it to, I'm gonna explain this.
I have exactly the
Yeah,
same wording. for
Right,
okay.
but the trouble is, one is what you have to check for, and one is who you can serve. So,
Oh,
so they can't both say the same thing, because
I don't understand why they can't say the same thing.
I see what you're saying.
And, okay, so it says in 17.4, no tobacco sales for anyone born or after.
Yep.
And then in 17.4.2,
Yeah.
it says each person shall verify that they are on or after by form of a government. So one's changed.
right. It actually should be, so every person, each person selling or distributing tobacco products shall verify that every purchaser
Is
is
before.
before
Correct.
January 1st, 2006.
Right, because one is what we're prohibiting and one is, or
Right,
considering prohibiting, and one is what we're allowing. So they can't have the same verbiage.
Oh, I see what you're saying. Okay.
Yeah.
So before
So,
2006.
yeah, so 17.4
That should be changed to 2006.
should say on or after January 1st of 2006. And 17.4.2 should say before January 1st of 2006.
And in terms of these exact dates of January, that's just picked out saying that if at the end of the hearing, we decide to put this in.
Correct, that's
So that, these are all
Right, the dates.
Oh,
placeholders
whatever.
right now.
Right, but
Place
whatever date, it can't be 2007. It has to be.
Oh, I know, I'm just.
Yeah, 2006. Yeah.
And in my research, some other communities did March.
Yeah.
Some
Yeah.
did January.
Yeah, I-
Whenever you're ready to
It's
launch.
gonna be ready when we're ready to
Whenever you're
launch, so
launch,
this
and we've
is.
determined that
just getting-
we've been able to
yeah.
give retailers enough time, whatever,
Right.
education and.
I don't know if we, it actually may make sense to almost just put it in right now as to saying on or after and then put a TBD almost. Final date to be,
Except, yeah, I agree with that. My only
I
concern
just want to
is,
say is to make sure we're flagging that we have to
Yeah.
go back and fix it before
yeah,
we can
Yeah.
finalize.
yeah. I just don't want us to fall into the trap of 06 versus 07. So
Yeah, I
we
think it'd
know
be
it
good to
can't
put
be
06, but maybe the month be TBD.
Yeah.
Yeah.
That could be. Again, we're still gonna be going through this to see if we enact it.
Right.
But I spent a long time with the calendar. Trying to figure out how old I would be in all these
Thank you
years.
for your diligence.
And by changing it there on page 12, in 17.4.3, first of all, it says on or after January 1st of 2027.
Oh,
that-
yes.
No.
That's
And
No babies.
no, so that has to be 2006.
20 years.
Anyone before we go? And also 13 has to be,
Yeah, 17.4.4 has to be.
So I know we talked about those last time, but I'm still confused. So 17.4.4.
Would be before. Is born
Yep,
before January 1st, 2006.
Yeah, for identification for the checking part.
Okay,
right.
so on that, what are we on? Set
It's
13?
born
Yeah.
Before.
Okay.
So on page 13, it would say.
So I'm
before.
still wondering, we say very specifically that we don't have adult-only retail tobacco stores.
Right.
So why do we even have things about how they have to identify? Why do we even including anything related to the practice at an adult?
Yeah, I think B and C will be deleted. In this, I have deleted. I don't
Sorry,
know
what
why
page
it
are
is.
you on?
17,
Okay.
13.
13.
It's 17 point, the first one. It says identify each person selling, distributing tobacco products or admitting entrance into adult-only retail tobacco store. We don't allow them here. So I think it just makes
That can be
this
removed.
cumbersome
Yeah.
to have things that don't apply to
Right.
our regulations. So I would just take that I recommend taking that paragraph out.
I would take the paragraph, I would just.
Yeah, the whole,
No,
Just that
each person
sentence.
selling or distributing tobacco, I would remove the or admitting entrance into an adult-only retail tobacco store. That's. Because it's still.
no, we
applying
don't,
to-
but we say
Going
that,
back
we
to
say
page
there in
12.
another place. We
Going
don't-
back to page 12,
Yeah,
right? Required signage. All retail establishments. You're gonna strike, including adult only. Are you suggesting, Maureen, we strike including adult only retail tobacco stores? Any reference to adult only retail tobacco stores?
yes, have we already said that everybody has to check? Oh, do we say anywhere else about valid ID? I thought we said it back here, so that's,
This is about signage.
signage.
Right. So on page 12, we got rid of
Okay.
everything else that was adult only
Okay,
retail.
yes,
So
I see what you're saying, this is for signage, okay, so I would
Right.
say taking out,
Under
just that
A.
one,
yeah, or admitting entrance, yeah.
right?
But I'm saying under A, required signage.
Yep.
All retail establishments, comma. You just want to say all retail establishments shall
Okay.
conspicuously post
That's on page
signs.
12, I
correct?
see, yes,
We're just
okay,
gonna strike including adult only
Adult-only
tobacco,
tobacco
retail
stores.
Yes,
tobacco stores.
right.
Okay, in A,
And remove the comma.
remove the comma, exactly,
No more
and,
time.
and change it to January 1st, 2026.
right.
Mhm.
So then on the next page, 17, then we're doing the same thing, we're striking identification, each person selling or distributing tobacco products. We want to take
Shall
out or
first.
admitting,
Yeah.
just take out, yeah, shall first, okay,
Yeah, so we're just getting rid of the or admitting.
yeah, okay.
Is that, actually, is that redundant with 17.4.2? It is. How is it different?
Well, it has to say it on the sign.
It's under the signage.
In other words, we already said that they need to do that, but now they're saying they also have a sign saying we're going to do that.
Right.
But that's,
It's already said.
that's 17.4.3, this is 17.4.4. It's not 17.4.3 dash. The required signage is 17.4.4.3. 17.4.4 is
Yeah.
its own separate piece. It's not about
Yes.
signage anymore.
No, it's all under the, oh, I see.
It's all under 17.4, and 17.4.2 states the same thing that I can tell, I can't see a difference. other than the word identification.
Oh, I see what you're saying, yes.
Yeah.
Yeah, I guess I want to see an unmarked up version, just make sure it's covered.
Yeah.
But I think 17.4.2 and 17.4.4 are
Yeah, redundant.
redundant.
That's what I thought of, Rich.
Yeah, I think 17.4.4 should be struck, the entire
Yeah.
bit.
The whole thing.
Because it's covered by
That's what I'm saying.
17.4.2.
Okay, great.
I
That
said, I
makes
was
sense
just trying to
now.
also make sure there wasn't any other difference in it that
Right.
wasn't captured
There
in
isn't.
Right, there
17.2,
isn't.
and I don't
Okay.
see that.
Good, thank you. All right.
So then 17.4.5 would become 17.4.4. Yeah.
Yep.
Okay. We'll obviously provide an
Yep.
updated version.
Okay.
So that's page 13. Anything on page 14?
Yes. Under 17.5.9, Part B, we have the Wayland Board of Health.
Right. Yeah, I got that too.
Yeah.
And since we're talking about that section, my question is, above it, it says, as the effective date of this regulation, no permits will be issued. Is it no new permits?
Yes, that's, yes.
Yeah.
And then I guess if we're not issuing any new permits,
Right.
then do we need C, D, and C and D?
Yeah, we brought this up last time because
Yeah.
it seemed redundant and I have the same question. It's like we said, we're not going to new, but then we have to list that they won't be listed if they're near a school. They won't be listed if they're 500 feet. We've already said we're not going to issue any new, right?
Well, is
Or
that
there
just
a reason?
giving-
I know we went back and forth
Yeah,
on this
yeah.
last time.
Is that just giving, kind of background on what the other permits have?
So we have 6 permits in Bedford, but
But did
we
we
don't have a
describe?
diminishing cap, which means we are not going to zero anytime now. So the permit with the business can be purchased or sold by another person.
Right.
So it allows them to apply for another permit. Because when the business is sold, the permit comes back to Board of Health. Again, they have to apply for the same permit to go to the same business owner. I mean, different business owner.
Right,
For
same
them,
business,
these-
but the same location, right? You
Yeah,
can't
same
change
location.
It has to be the same.
Same location,
Yes.
but this just make sure that it is in page so that it is not going to be moved from that business, I mean, some the location.
It also helps us if, let's say something else opens, like a school near
Oh, that's
where
right.
an establishment is
Yeah.
currently. That's what I think.
Yeah,
Now,
yeah,
going
Yeah,
back to our
Okay.
last
It
meeting.
can be
Okay,
educational or a healthcare institution.
right.
Right,
Something that
got it.
changes
Right.
geographically.
got
yeah.
it.
Yeah, I think so. It's good to have it in.
So
here.
then should 17.5.9 B, if we're saying no new permits will be issued, should it be no new permits at new locations? I mean, because we're
Oh,
saying it isn't that the permit gets transferred. So say at the golf station, the owner sells it, that new owner has to apply for a permit, but they're
At that
allowed because that's
location.
an existing permit, right?
Yes.
So no new permits or only permits to existing permit locations. I don't know how to say it. You know what I'm saying?
Yeah.
I would say, if we're gonna do it, it would say no new permits for new locations.
So if you see the point E under the same, 17.5.9 E, the valid tobacco sales permit approved by the town
Yeah.
of Bedford Board of Health at a given address as provided in the application form shall not be relocated to another address. That covers.
Yeah, that's
That
very
covers
clear.
us, yeah, so we've got it.
Okay. It still feels confusing to me as people read through and it says no new permits. And then all of a sudden we have one that says, you know, we're going to give a new permit if you It's a
It
valid-
says, I believe it says no new applicant. That's the difference. It's not permit, it's
Okay.
applicant.
Ah,
Yeah.
okay.
Well, it doesn't say, it just says, okay,
It says no new,
Fine, I'm not
sales
gonna-
permit shall not be issued to any new applicant. So
yeah, okay.
that can be when, a new person takes over a place. They're a new applicant. So then in that case, if you had the Gulf Station and then somebody built a school, we decided to build a school within 150 feet. Now the person knew that transfers over, that permit cannot then be transferred to that
Right.
person because they're no longer outside that 500. The
Yep.
existing will continue. It's grandfathered because the school was built after.
Right.
But it would not be able to be transferred in that situation because now there's a school within 500 feet.
Okay.
And again, I'm sure our legal will go over all of this. Keep going.
Oh,
So.
all right,
Yeah.
okay.
I have a comment.
Yep.
At the bottom of page 14, 17.5.9. All the way at the bottom, the last word is a misspelling
Oh,
for 100. It says 100.
500.
Oh, yes, hummingbird, yeah.
Thanks.
Sorry, did you see that?
Yeah.
Good catch.
Hmm.
So I think, where are we now? Page 16,
15.
15? That was what David just referred to.
Right, yeah, but we didn't look at the rest.
But we made no edits on
Right.
15 to date, aside from, we'll just adjust the text.
Right.
The font of E,
Yeah,
Yep.
obviously.
okay.
Anything on 15?
Oh, so that's so weird. 1710. Prohibition of the sale of nicotine pouches. The sale of distribution of oral nicotine pouches is restricted to adult-only retail tobacco stores, but we don't have any.
That's what I'm
Right.
saying, that has to be
Yeah.
cleaned up. I would like that taken out.
Right.
So should we take that out?
That's on page 16, right?
Yeah.
Yeah.
I thought that's what we just discussed,
Yes.
taking that out.
Yeah.
May I ask?
Wait a minute, what are we talking about? We're jumping around. too
Page
much.
Yeah, I
16.
know.
Are we on, we're done with page 15 now?
Yes,
Okay.
I.
So we're moving on to 16.
Right.
Gotcha.
All right, for 16, I have a question because 17.1, 17.2, they list a dollar amount for a single cigar or 2 or more cigars.
Yeah.
Is there a justification? Is there a state law or something around that?
No,
that's-
actually, we
that's-
can go for, I mean, it's decided by the Board of Health. This is the number which has been used across the collaborative, and Concord is one community in our collaborative having $3 for a single cigar. So it's up to the Board of Health. You can decide.
What difference does it make?
Because the thing is you don't you want to discourage single
It's
cigar
again-
selling.
Yeah, it's the regulation
But
for
and
restricting
why-
the sale of tobacco products. So if you are increasing the price for single cigar or a pack of 2 or more cigar,
But should we just say
Well, I'm not
single
familiar with-
cannot be sold? I mean, instead of
Yeah.
just trying to put a price on it? Shouldn't we just say that a single one cannot be sold?
But there's original, in point 2, there's original factory wrapped package of 2 or more cigars. I don't understand this, and I don't know how cigars come, so why,
It's in our last copy.
The
You
state
can buy them in
regulation-
single or multi-pack.
Yeah.
yeah, so why do we have to put a dollar amount? If a convenience store is selling it for
There was a
$4.
reason, DJ had a reason for this
Yeah.
originally. And the original,
remember
when
that.
we originally had this and DJ was our original consultant from the state, well, from MMA. It's hard to
MHAB,
explain. Yeah, from-
MHAB,
yeah, okay, was it?
MAHB, Association
MAHB,
for
okay.
Health Boards.
So there was a reason. We're gonna have to take a pause on this unless you have the answer to it, because it's either a Cheryl question or a
Yeah, so basically,
Lisa, good night question.
cigar pricing is not decided by the state, it is decided by the Board of Health. And the minimum price across board is across Massachusetts to $2.50. And each board can go more than or increase the price more than $2.50.
But for what purpose? What, I mean, what would be our role in saying how much a tobacco has to be? You know, if we don't do that with any other product. We don't tell people what they can sell their cigarettes for. We don't tell people, you know, we don't put limits or say it has to be at least this amount. I don't understand.
Does the MGL say that boards of health can set cigar
Yeah.
prices,
Yeah.
but they can't set cigarette
Cigarette
prices?
price is the state.
That's the difference.
They can set.
We can.
Why?
Why do we want to even
We really
set
need
it?
to do it.
Is there egregiously people selling them cheaper?
Yeah, there has been.
Really?
Yes,
So
that's what
they-
DJ said. That's the
Yeah.
reason DJ originally, they originally set it was recommended to set a minimum price. Now, I don't know why we're at this number, like if
Right,
this
two
number.
ninety. I don't
Yeah.
know. We'd have to do some research and say, what are our stores
Yeah,
currently selling
I
them
know.
at, you know?
Do we
I mean,
know that
Well-
is that just a statewide average number? That
250 is the average
250 is the average currently.
currently. I think we
Okay.
had 250, I believe. So now our collaborative is moving for 290. So I thought I can plug in that number, or if we want to have 250, that's fine.
It's just an odd number. 290.
So other communities have set it at 290? How many other
Yeah.
communities have set it at 290,
Um,
would you say?
I would say like out of 16 as of now, 9 to 10 communities.
So,
And Concord is the only one having like $3 for each cigar and
so Concord has set it at higher.
higher.
So just trying to be consistent with what other
Towns are doing
Yes.
around us.
within our collaborative.
Well, to me, I just say make it $3 because 290 just feels so
Yes.
arbitrary. It just
Yeah, I
feels
know.
like,
By 290, Pari, why that number?
like if the average is 250,
The
where,
board
how
is,
does?
yeah, if the board is happy with $3, I have no comment on
I
that.
see, okay.
They were probably trying to keep it below 3.
Yeah.
They wanted to make it.
Which is what, I'm just using gas stations as an example. Gas is 99 cents. It's,
Okay, all
What?
right.
99.9.
yeah.
It's again, the number I picked because it is across the communities in collaborative, but if the board wants to go
Okay.
250 or 3, it's up to the board decision.
Okay. I was just wondering why that was there.
Yeah,
In the first place, but
Mhm.
that's,
And again, this number, I mean, the model regulation is from the MHOA, MTCPTAs, so they give the numbers and possible policies which can be adopted. Maybe the numbers came from MHOA, I don't.
Okay.
I think that's also to prevent coupons, because coupons are prohibited too for tobacco.
Okay.
I don't understand 1783.
the wholesalers. Doesn't apply to wholesalers.
Right.
So
That's all in there.
this whole section, so meaning so the wholesaler doesn't have to charge 290 for a single. Is that what?
Right, a wholesaler who's selling the cigars to the local
Yeah.
place, or whether it's with,
So the wholesaler could be charging $3 and we're saying they have to charge 290. I mean,
well, no, it's a $2.90 or more,
okay,
or more.
Right.
So again, it's just basically saying we don't not have the authority to basically prohibit wholesalers from doing
Okay.
business
all
within
right.
this,
Okay.
by this
Yeah.
rule.
And the or more is important. So, you know, like, I'm okay with the 290.
Yeah.
Like, because they're gonna charge what they can.
Okay.
At least we've got the last clause there saying we can adjust it.
This is very picky, but 17.2. Is it getting late or am I seeing more space between the lines?
17.2, you're going all the way back?
17.
Oh, you're right.
8.2.
You're right. It looks like it's
Oh,
one
it's just
point and a half or
formatting, yeah.
1.15 or
Spacing.
something. The spacing. The spacing on the second
Yeah.
paragraph is off.
And then also at the bottom, 17.11. The last sentence, retailers, there's like a,
There's a gap there.
there's another gap, yeah, there's a
Yeah,
couple of
yeah.
gaps there.
But part of that, I think, is due to track changes.
Yes, that's true.
Maybe, yeah.
So just, I mean.
But you're right. what you're
It'll be
seeing,
a-
your eyes are
a
still.
formatting
It's
check
not,
in the
it's
end.
not that, it's not your, that it's solely. yes.
Yeah.
Yeah.
So we're striking 17.10 then?
Yes.
So we're done with page 16, am I correct?
But let's review. We're going to double check the font again, correct? On page 6, which these last 8.3 and 8.4. I think 8.3 and 8.4 is off. I think that font is wrong.
Oh,
I
okay.
think the wider space font is more what's used throughout the
Okay,
rest of
all
the
right,
document.
right.
But we'll double check it.
I would just say check the font and spacing
Yes.
throughout.
Throughout,
Okay,
It's just the
After accepting,
Yeah, because it's.
The
off on
changes,
the
I
goals,
think.
too.
Yeah.
QC before.
All right, check
publish.
font throughout. What else? Striking 10.
Yes.
Yes.
yes, correct.
Anything else?
Nope.
Okay, thank you.
Page 17. If nothing on 17, I'll move on to 18. At the bottom of 18, it's not to a person under the age of 21, it's born on or after January 1st of 06.
Oh, yeah. So 17.20.
Yes.
1A
Correct.
should be by the date.
As should be
The
B.
next, and C.
Nancy.
Yeah.
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 All you have to do is just do a search for age
Yeah.
of 21 and
Yeah.
then you'll
Yeah.
catch all of them.
Yep, we'll update that.
Okay, so anything else on 18 or 19?
Hold on.
Yep,
Hold on. This is for violations of MGL Chapter 2, and when you go into 17.20.1,
Oh,
that whole section is relating to the MGL.
Yeah.
you're right.
So the MGL is currently 21.
Oh, 21, okay.
Sorry, just want to make that clarification.
You're right.
All right. Oh, yep.
So how do we?
yeah, well,
okay.
and that goes actually.
But then
good
it
catch,
goes
right?
down to, then it goes down to 17.20.2
Yeah.
is our regulation.
Why do we have to include the state one? These are our regulations. Why do we have to, it's very
No,
Because
confusing.
of
this
page
was-
20,
What's that?
because of page 20, which are the state and which are ours, which I think needs to be updated.
Yeah. Here actually Board of Health is implementing state and local regulation.
Right, I was gonna say, we're still the authority who's implementing the violations that are listed, so they have to still be listed in our regulation.
But here we're listing what the finding is and everything else for the state, and then we say, well, here's the finding for Bedford. And
No,
I can see,
sorry. I think it's because, again, we're the authority. So it's not the state's gonna come in and do the fining, right? It's not-
Right.
The state's
do
not
it-
doing it. The town of Bedford will do the fining of
Of the
somebody
state
under the age of
regulation.
21, under MGL, you know,
no, not if we change it to be the birth date deal. Because I guess that's my question. I just feel like sometimes these regulations have more information and they're onerous when
Okay,
you
I
try
see
and
where
work
you're
their way
going. Right.
through. So if what we are enforcing, we can't be less restrictive than the state. We worked a long time to make us
Right.
more restrictive and be
Right.
comfortable, and that
Right.
should be what's listed there. And I think to list what it would be in Massachusetts, because that's gonna be very confusing to a retailer.
Yes.
Right, so
Right.
couldn't we change 17.20.1 to just remove the MGL stuff? Because,
No, because the MGL is specific with these fines. We don't have authority to fine at this level. The Board of Health does not have the authority to fine at this level. It's the MGL that gives the authority to the
So-
Board of Health to
so-
fine.
So can we just say in our part pursuant to MGL, we have the authority and here's what we're doing?
No, I think it's because, I think where it's coming down to is, the 1720.1
Yeah.
with, under MGL. If you were to sell to somebody who, let's just say this law's already been enacted, the rules have already been enacted. If they sell to somebody who's age 17 at the time,
Yeah.
okay? They're applying the rules, the fine, the violation is gonna apply under MGL 270, section 6, whatever it is. And it's the $5,000, $2,000, $5,000, et cetera. Then, if you have somebody who's age 26, but they were under 21 at the time the rule was enacted, they are no longer covered by MGL.
No, but we changed our tobacco regs last year, 2 years ago, I lost my time.
Yeah, a couple years
Very
ago.
carefully about this to say, we want to be a little bit, here's what the fining, within the guidelines MGL gives us. Boards of Health can determine the fines and we changed it to very definitely the suspensions of the sales was 3. And we went through all that work to say, we are within Massachusetts guidelines.
Right, that is B and C.
Right.
That's B and C. But, and I don't know, and like other towns have enacted this. My question is, what did they put in A, B, and C? Because
Yeah.
I hear what we're saying, that we have to say 21 because of MGL, but that doesn't make sense based on what we are potentially
Yeah, I understand.
enacting.
Yeah, so the regulation for the restriction of sale of tobacco actually implements, this is Board of Health of Bedford regulation, but also the grant allows us to implement state and local regulation. Wherein if you see page number 20, the policies, state law fine is there and local regulation fine is there. The only addition we should do is, we have to add no sale of tobacco products to whoever is born on or after that date on the top, which includes
It needs to go on
top.
the right side.
right side.
Yes.
Correct,
Then-
I wrote
Yeah.
that down too.
Yep.
That will cover what we are doing, but we cannot, I don't think we have the authority to remove MGL, which is in 17 point.
Okay, so what you're saying is
2.1.
that the fining structure and the suspension for this column
Yeah,
is what we would go by. And these policies, so we move that one over and our fining and suspension structure only applies to the second column.
yes.
Okay.
So the difference
All right.
between the state fine structure and the local fine structure is, state fine structure, first violation is $1,000 fine, second violation is $2,000
Okay.
fine with 1 week permit suspension. Third violation within 36 months will be
Yeah.
$5,000 fine with 1 month permit suspension. But this structure will not be applicable for local regulation. First violation, second violation, third violation, everything will be $1,000 fine, which cannot go beyond $1,000. That is what Cheryl has explained us.
Right,
So,
okay,
The
all right.
suspension
As long as
days
we
for-
change that list there. Okay.
Suspension.
It's the list,
suspension
right?
days
When it
for
comes
candy.
down to it, it's the list that has to. be.
Suspension,
Exactly.
Okay, that
Yeah.
makes sense then, because I was like, whoa.
Okay, so the list has to now have on the right-hand side, born on or after 1106. Any other changes based on pouches or any other changes that we made?
Yeah, pouches will come under this again. We have to add that.
We have to update that,
Yeah.
yeah.
Yeah,
Can we go back to page 19?
sure.
1720.2.
Mhm.
That first paragraph, it says pursuant to GL instead of MGL.
Oh, yeah.
Yeah.
Okay, so if we see this after that's updated.
So I'm just gonna ask a general question. Any other changes?
Did we do page 21?
Oh, I ain't having any on 21.
Oh, okay.
So I moved on, 21, 22, 2021 and 22.
Well, Pari, can you just double check the list to make sure
Yeah.
that the list is
Yes.
updated? for us?
Okay.
Okay.
Just a list
Based off of,
doesn't, because based off of what we wrote, like, so 17.10 that we struck. We struck because we're not prohibiting the sale of. Are we prohibiting the sale of nicotine pouches or are we not?
Yeah, they're legal to sell in the state, but we're not allowing them in Bedford.
Right.
No
we
nicotine
struck 10
pouches.
because it's adult only. We don't have any
Adult.
adult. only.
Okay, so
We're
that
striking
means,
the adult only.
so that needs to be identified in the list on policy subject to local regulation.
Yeah.
Because that one's missing.
Right.
Pouches
pouches,
are
pouches
missing,
have to be
Pouches
there.
is missing and born on or after January 1.
Yeah.
Okay.
Those two together.
The only thing is page 22, which is the last date has to be, so
Updated.
it's updated.
Right,
yeah.
yeah.
Yep,
Yes.
okay, that's all I have.
Yeah.
Yep.
Which again will be a TBD. We can, well, we'll put something in there.
Right. So we just spent a lot of time going through this. As I see it, and please correct me if I'm wrong, we could vote to accept it, assuming our changes are made.
Mhm.
We could review it again.
Yep.
We could, once we approve it, the next step would be to have a hearing, notify all the local
So
retailers.
wouldn't it be to send it to council?
Right, so it would go to
Council
council.
first.
It would go to council, then
Then
there would
after
be
that,
a notification of all the businesses in the community and we'd have a hearing.
mhm.
But we have to figure out first, do we want to move it forward or review it again once our changes are made?
Sure.
I would prefer to review again.
Yeah, I think it makes.
I'd like to
makes
review it
good
again in the
sense.
hopes that Anita can join us. You know,
Yeah.
she's worked on this
Yes.
policy all
Yeah,
the way through,
for-
and I'd like to
yes.
hear us.
No, I agree. I just wanted to put
Okay.
all the options on the
Yep.
table.
Yeah, yeah.
Yep,
Sure.
it'll be a quicker
That's
review
good.
next time.
Yeah. So, my request for our next review
Mhm.
is we get it with track changes on
Okay.
and also track changes
Oh,
accepted.
okay. Yeah.
So we can read it as a completed document and not question.
Okay,
Because, at least for me, I find it difficult to look at track changes and know ultimately what it's going to say and the font and the
yeah,
spacing.
yeah, so it would be just like it would look if it was
Yeah,
the policy.
exactly.
Have both versions, yeah.
I have both versions, so
We'll
we
have
can
this,
read
yeah.
it either way.
Yeah.
I also just wanted to acknowledge, I know a number of people reached out to us ahead of this meeting. We haven't made a decision. And we will review it again. And for anyone listening to this, at our next meeting, again, it's not a done deal. I anticipate us taking a vote and having a discussion of it and then taking a vote. But then again, it goes to a hearing and it goes to town council. But, you know, I think there are questions that everyone has, not only on the verbiage, but then also, is this something they want to do?
So in terms of, it's not just the verbiage, so at the next meeting, the vote we're taking is only to have a hearing on this.
Correct.
Yes,
And then after the hearing, we vote whether to accept.
Yes,
to-
that's correct.
It's
Okay.
basically, it's accepting this as the final
Draft.
draft to submit
Right.
to the
I want
town
to-
council.
Town council.
Town council, provided town council that doesn't have if they have many substantive changes, it should come back to you guys.
Exactly.
right?
Yes.
Yeah.
But then, and then maybe for another, like, vote to move it forward, but we'll have incorporated town council's comments. Then at that point, we have to post a legal notice that we're having a hearing, right? So that'll go into the paper. And during that process, we post the draft to the website so folks have access to it, because we also in turn send it to all of the current retailers so that they have a chance to digest it and then be able to be present and informed in advance of at the hearing, so that they
Yes.
have the information. So there's more of a process. Again, the vote is just your approval that this is the final version, blah, 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 to move forward to that process.
Right.
We
But
are
you're
not
not-
enacting the rules. We are not
Exactly.
endorsing the rules. We are
Right.
not.
Yeah,
At this
we
point.
just want to make sure that we have a version that we can discuss and have a hearing and let the
Well,
community weigh
in some ways, this isn't just enacting the rules, because we are adding the component of the nicotine-free.
Yeah.
So it's beyond just saying, this is what the state says we have to do.
No, I'm just saying we're not saying that we're voting this up or down or
Right.
anything like that at this point in time. We are just accepting the draft.
The draft.
Right, and we're not doing that today.
But you're not doing
We're-
that
today.
Right, we're not doing that today.
Okay.
We'll do
You
that in the
decided to
future.
have a more, another
View.
updated version.
I think it's important.
Okay, that
Yeah.
sounds good.
Okay. Thank you, everyone. Thank you.
Thank you
Laura.
so much.
Thank you, Pari.
Thank you.
Okay, so continuing with our agenda, okay, so at our last meeting, we talked about the Board of Health goals. And thank you, Heidi, for sending out all our
Yeah,
links.
that's
thank you.
great. It's great.
And we can go through them. Thank you, Marisa.
Thank Marisa.
Thank you.
There are some that fresh perspective, it might be something else that you, fresh perspective, it might be something else that you want to take. So I'm not sure we'll be able to review all of them today, given the time, but I would like to at least go through the ones that we have, like we're starting with number 1, which is the Board of Health role and responsibility.
Mhm.
And just discuss if there are any that we're pretty much done with, or if we've got next steps on. As an example, Board of Health regulation review, there's no framework for that because that is just part of the board and the chair's responsibility in working with Heidi. The next 2, enhancement of the health-related communications and identify public health emergency community advisory task force, both came out of COVID.
Right, and the thing is that it is hard to do, is like, for instance, the Public Health Emergency Community Advisory Committee, I've got like, our list and,
Yes, we
all
talked
this
to
stuff.
the major players. Yeah.
But I feel like it's almost as if, it's there, but we did this like a year or 2 ago, right, where people agreed to do it.
Yeah.
So I don't know. That's the thing I'm missing here is,
Well, that
what
one
happened.
we have as done. So C,
No, it's
it's completed, but the next
develop process for
is
engagement.
now ongoing, right?
Yeah, I guess I didn't differentiate between the 2, but yeah, I see what you mean. Yeah, because I think, I don't know, to me, it's.
This is
all
where
about
I get
communication.
stuck.
Yeah.
I know the original idea was to bring people together and have meetings and I just feel like there's a lot of unnecessary meetings in the world today, and people are kind of
I know.
tired of that. So I can see us at this point saying a couple of years ago, post-COVID, we met with you, you said that you would be a partner with us should an emergency happen. And, we haven't forgotten, blessedly, we haven't had any major emergency, but, we are still, the plan is, should there be an emergency, to pull together people. And it might look different depending on what the emergency is, So I don't know how to make it more, to pull people together to just sit and say, well, hello, everybody, thanks for doing this. We don't have an emergency yet, but.
Well, to me, I'd love to repurpose it and, to acknowledge that, yes, we reached out to them.
Yeah.
And then the other thing is to really push for the whole thing with updates and any kind of communication stuff that we can. You know what I mean? To use it as a vehicle.
I don't know what you mean.
So,
Use what as a vehicle.
to reach out to the task force, to the folks on the task force again, and acknowledge that, okay, we haven't, we reached out to you, we haven't had an emergency, but we just wanted to acknowledge, that you had said that you would.
I think
do
we can
something.
keep them in the loop. We could say I don't know, maybe you and I need to.
Unless you wanted
say-
to, are you suggesting be to absorb them into maybe the communications portion of the goals? Like, so we have this group that is sort of committed to, or we've identified would be interested in participating in a task force. Do we utilize that group as the springboard for promotion of public health resources. Or like, you know, our community, when we're talking about like, you know, amplifying messaging
Right.
and
Yes.
stuff, right? As the amplifiers, do they
Right.
then become, or do we want to keep it separate? I guess is the question.
Well, the amplifiers, we already talked when we met with them.
Yeah.
You know, like we would say, you know, would you use, look, and I met with the person with the Rotary. I was saying, you know, we would look toward, you know, your contacts to spread information, dispel misinformation in the community. You know, so I just find it hard to think, I think how this community task force will function would be different depending on what the emergency is,
Yeah.
what the crisis is.
course.
I agree with that. And to sort of everyone's points, I think it would be valuable to know who's on the task force.
Yep.
And maybe encourage them to subscribe to the e-alerts so they know the messaging being put out by the
But
health
also to
department.
use their lists to
And
amplify.
then they can amplify it if they so choose. We would ask them to.
Yeah, sure.
Type of thing. But
Yeah,
rather than, to your point, Maureen,
just to make a tabletop exercise that,
yeah,
You just don't
I don't
find
want to have a
viable.
meeting just to have a meeting,
yeah.
but I want to loop them into what's
Yeah.
being said. And, you know, we can encourage them to subscribe and amplify.
Right.
We can't force them to.
No.
It's a volunteer outreach. But I think some of them might be interested and they might not know about the
So to
e-alerts.
amplify the but the e-alerts are not necessarily crises. This is an emergency task force.
No, I
So
understand that.
mosquito spraying that comes out in the e-alert, you know, isn't something that's that wasn't what this advisory, this is supposed to be a group that, at least the way we envisioned it, and when I wrote the framework, the idea was you have a crisis like a pandemic, and we said last time what was missing was that we didn't have this group that we could get feedback about how things were going in the community, and that we could talk to about this is what our plans are, this is how we're handling it, and get that kind of feedback. Kind
Right.
of what North.
But why can't it be both?
Because they didn't sign on for doing things that weren't emergencies. This is supposed to be a crisis task
Well, we
force.
never asked them.
Yes, we did. We sat down and we said,
Yeah, but we
like-
didn't say, would you mind doing this? I mean, I don't see what the,
well, then I would have to rewrite the framework.
Look, emergency
If
is
what we're looking for is
good.
community partners that can be our partners in anything health board related,
yes.
that's something very different than what the framework is. That's totally different. When we met with the fire chief, when we met with the police chief, when we met with, you know, the
Yeah.
minister, when we met with,
Yeah.
you know, all these people, it was talking about in the event of a
But we also
public health
said,
crisis.
would you mind doing this? And
No, we talked about in the event of a crisis, would they mind? Would they amplify things about the crisis?
Did we reach out to people for the communication framework yet?
No.
Like, we haven't done that yet.
No.
Not of,
As far as like making the ask for like, will you amplify?
right.
I
And
think
that's-
that's different.
No, I get it. I'm just asking if
Yeah.
we've done
And
that
I'm
other-
not saying it has to be the same people, but I think we have a list of people from the task force. If we wanted to now reach out and just say, would you amplify our messages? Just in
just
general.
note, when speaking with these stakeholders, we'll ask for two-way communication and get them to set up health alerts if they're willing to send these
For
out in
the
your
public
email
health.
lists.
Right,
Emergency.
but I'm just saying,
Yeah.
I
Okay.
might be wrong, but
Okay.
I agree with you, Maureen, that they're set up for an emergency.
Yeah, and
But
that's
I'm
important.
just saying,
That's very important.
could we reach out to them just as a community leader?
But you have to, the people we went to initially, when we had the full list of all the people in town, we started with the people mostly towns, so police chief, fire chief, you know, all those people that that would be amplifying. I mean, how's the fire chief going to amplify the health alerts? How's the police chief going to amplify the health alert? They agreed that should we form a community task force, they would have themselves or a designee that would sit with us on that task force.
Yeah, I see it different. I see like you're
Yes.
working within this realm of people who need to make really important emergent decisions about an
And
emergency.
advise us, give
Then
us
the, then the
feedback.
information comes back to the Board of Health, and then you use your communication outreach people to get that message out. You're
Some of
asking
those
two
people
different
could be,
things.
some of those people could be the same. So
Right.
That's
say,
all
for
I'm
instance-
saying is some of them,
Right.
that's all we're saying is some of them could be
So-
the same.
Right, so I don't wanna send a letter to Chief Amendola about, we need to meet with him and explain this. I'll meet with him again, and explain that, because he knows nothing about this. But I think there might be some same people on this, and there might be some different people that we're reaching. They're not necessarily the same group. Because if you're thinking of community partners, like all different organizations, parent groups, and we didn't approach all those little parent groups yet.
No,
We
no.
didn't-
Right, because that's the
I'm not
larger
referring to
community.
that.
That's
That
the
was
larger,
community.
we upgraded
We had-
the initial
we had-
stakeholders that were gonna be
Yeah.
the most important
Right.
in a crisis. Not-
Town and- yeah.
So I think that it's not that these two can't work in tandem, but I think we have to be very clear if we're talking about this emergency advisory task force. That's something very different, and I don't wanna start asking for other things from that group under the guise of you're agreed to be part of this
No,
emergency task force.
And that's not what I
Okay.
was suggesting, and I don't think Bea was suggesting that either. It's more of we have a list of people,
Yeah.
and we have been saying we need people to help amplify our messages. So I guess my question is, going back to this, Bea, you and I are working on the communication part.
We should
I
meet
have
it.
C as completed, which is identifying the task force. My question is D, developing the process
Yeah.
for the task force. Is that ongoing? Should that be paused?
It's ongoing because we need to give some thought to it, because should we have a crisis in October?
Right.
So what's
Okay.
our plan for?
So it'd be
going
good
to
if
be-
we,
yeah, so
maybe
yes,
we should meet.
We should just meet, and we will come forward with a
Get
rudimentary
new
plan.
people, we have to update the people.
We'll
involved.
update the people and we'll come and say, should we have a crisis in the next year?
Yeah,
This is how we would proceed.
that's right.
We can come up with that.
Yeah.
Yeah. that-
And
that's good.
then, okay, so, and then Bea, I'm happy to work with you on
Yeah, on B.
amplifying.
Yeah,
David, if you want to help with amplifying our messages from a communication standpoint, I'm happy to hand that off to bring you into the loop.
Yeah.
It's really what's
If you
best
want,
for
like,
you.
So if you want to wait and hear about all these and then see what your interest is.
Yeah.
Yeah. Yeah.
but that's
But-
that's a potential.
Right.
That's a
anyway.
potential. Okay, okay, we did talk about, and this, it was a proposed, goal, but, no framework about just clarifying the health department and the Board of Health. And I think we've done that as best as we can. There are still people who refer to the health department as the Board of Health.
Yeah, but I think we've
Yeah.
been doing that now
Right.
for a couple of
Right.
years, so that's
Yeah.
good.
Environmental concerns, all of these were proposed.
Yep.
So there's no names, so if anyone wants to pick any of these up
But I
or not.
think gas-powered leaf blowers at this point is done. We said we were going to recommend to the select board. It's up to them to do something. If they decide to form a task force and invite one of us to be involved in it, then we continue. But it's like with the reproductive and the Minuteman
sent a letter.
Bikeway.
Yep.
Yeah,
We
we did.
made our
That's fine.
recommendation. That's what we were going to do.
Okay,
All right, so.
so that's done.
And the ultrafine particles from Hanscom and highways, to me, we had a, session in January. It's kind of interesting. It's, to me, I feel like it's kind of paused because we're still waiting for the government to grind through the memorandum of understanding and all this other stuff. I feel like there's I don't know if we want to say it's really done, but it's just, I feel like it's paused right now. I don't know
Yeah,
how you
and
feel.
that's okay.
Heidi, I
Yeah, I mean, the only way, the only update I have on that is really that the community advisory, the Massport Community Advisory Committee is not gonna be issuing grants. They've decided to not do that. What they do have is that they have They have monitors that they've purchased. They purchased 3. I think they have 3 and they purchased 3 additional monitors. And they're going to be willing to loan those out for a period of time with access to their consultant who is doing some of the ultrafine particle work around Logan. But they would work in conjunction with Dr. Who. I mean, we would have ability to kind of pull in some of her, recommendations as far as location. So they were
So it's
offering
kinda
one.
like-
They were offering one of the 3, and I said we would need at least 2 of the 3 for at least a year.
Oh, yeah.
So I have to get with, and I just had the conversation last Wednesday with the executive director. So I have to get with the representatives from the surrounding Lincoln, Lexington, and Concord, I guess. Or is it does that make sense? Was it those 4 communities that we were originally talking with? I mean, I can write the proposal. I might just send it to them and say, hey, I'm gonna ask for this stuff. I don't remember where Dr. Huda, she said 1 fixed and 1 moving,
Yes.
so
Yes.
maybe that's it. But again, it's, it's labor intensive, so I'm not quite sure if we have the commitment from their consultant to do that work, like who would do the
Yeah.
movement work, like how often we would have to move them. That was sort of like something that Dr.
Right.
Huda had she sort of had the finger on the pulse.
The thing
of
is,
what
like,
was-
one recommendation was a high school student or something. I'm like, that's just not
Yeah.
gonna be.
And just keep in mind, we don't have a framework for this, so
No,
it's
we
not
don't.
it's
We
an
don't.
activity of the
Yeah.
health
Yeah.
department and the Board of Health, but it's not
That's
a
right.
goal at
That's
this
right.
point. And I agree with you on the leaf blowers. PFAS was raised.
It's ongoing, right? I mean, it's,
But I don't think it's something that we're going,
because right
To
now,
do anything
wouldn't
different
you
on it,
agree,
yeah.
Heidi, that the regulation for PFAS is doing its work?
I mean, from what perspective? I mean, it was, the EPA lowered their standard. I think they lowered the standard. DEP has not accepted the new standard yet, I don't think. I'd have to do some more research on that. I mean, it's done its work from the perspective of, resulting in homeowners having to spend more money to get off their wells, right? And to have to connect to town water if it's available,
Yeah.
or to have to purchase and maintain, monitor, filtration systems.
right,
Yeah,
right.
it's brought awareness,
Right.
brought awareness to the issue, I think. But yeah, what more would we do?
I
mean,
know, that's
more-
what-
Yeah, so what
that's
more,
what-
so we did our program where we reached out to the known wells.
Yes.
We gave them education, and we got very little interest in having, in taking us up on the well sampling that we had funding
Really?
to do. Yeah, very
Well,
little.
I think in this whole topic, I think there's more we can do. That was just with homeowners and water. But certainly the whole topic of PFAS, there's a wealth of information that
Right.
needs to get out to people. People are very concerned about, at least, I am. I'm still trying to figure out where's the PFAS coming from? How can I?
What consumer products, like other
consumer
consumer products
products
that I
that-
can limit?
Yes.
I mean, there's also other environmental sampling being done, that the base has just picked up, has just started their PFAS testing. And they set, they set an arbitrary limit. I think it was the Great Road. They basically said, this is from here back is where we're gonna do our sampling. Which just happens to be immediately south of where our town wells are, right?
Okay,
You know what I
yeah.
mean?
does
So it's-
anyone want to, because right now it's just proposed, does someone want to pull together a framework?
Is it a priority? Are there others,
Well,
other
that's what I'm
items that are
saying. I'm just
priorities?
putting it out there.
I would put that down as a possibility as we move through the year. I'm interested in it, but if I'm working on the task force and some other gun violence, I just can't take another one on
Yeah.
right now. So I would say that we can keep that on our radar.
Yeah, they're all on our radar.
We need someone to attend the Hanscom Rabs, and Hanscom and Navy Rabs, where this information is gonna be, they're gonna talk about the sampling results. I mean, PFAS, so that's a big part
That
of.
was something that I was.
Yeah,
interested in.
you
So
were gonna
maybe
do that.
But maybe the
Yeah.
PFAS is really just kind of like pulling that data and kind of
Okay.
doing a mini, just update annually
Yes.
when those meetings are held.
Yeah.
And
Okay.
then maybe from that, something else comes about, or we
That would
end
be
up
great.
having someone come and talk about it
Yes,
from
yes.
David's got that.
from the
Okay,
Yeah,
great.
But I think the whole consumer
and the consumer
is
part of
really
it.
huge.
But
Yeah, you're right.
that's stuff that we can do, like, we either work with our next intern, or we can do a lot, we can pull information in and do outreach to the
Yes.
communities
Yeah.
on
I
that.
think
So we
that-
can look at that.
I think that would be a valuable service if we did that. Okay.
Okay, multi-generational, I'm gonna skip over, the one that Anita and Bea are working on, just because the.
I mean, right, at this point, we're doing more advocacy, I would say.
So. Okay, so that's advocacy. And then the Minuteman Bikeway
That was done.
that was done, and that indicates that. Overall health, school start times, reproductive health are both done. Food insecurity,
That's important.
yeah, Anita and I had initially worked on that, and then
Yeah.
you were gonna take
'Cause
over, and it's
that's
really
right.
advocacy.
That's right, and definitely, Heidi, Anita and I should just meet with you, I think.
Yeah.
Really, I want to get a understanding of where we are. 'Cause I
Sure.
know everyone's kind of waiting for which axes will fall.
Right.
And then what are we gonna do about it?
Yeah.
And because, I mean, our town meeting, remind me, is it still in March next year, or is it, or?
Yes.
even
It wasn't
before a
changed.
year,
It
right?
didn't change.
It didn't change,
did not
only
change.
the election changed? No,
Nothing
I'm
changed.
sorry.
Nothing changed.
Nothing changed in the end?
Nothing changed.
Really, nothing? Okay, I
Nothing.
sorry, I was so much back and forth, I was like,
Mhm.
what? Okay, anyway, so, yeah. So definitely, that's what I would say is.
I'm sorry, but you were trying to make a
so
connection
I-
between the.
Anita and
food
I, I'm
bank
gonna put down, I want Anita and I to meet with you and talk about timing, because if we really wanted to try to push for a line item in the budget, for instance,
Mhm.
we'd have to know that. We'd
Oh,
have
yeah.
to start.
Oh,
Is it
yeah.
a line item in our budget or is it a line
No.
item in youth and family service and health and?
Well, I mean,
It's not.
Yeah, well, there's no
Whatever.
line items.
There's
But
no
where-
line
where-
item.
If we want to
right,
push for them, why
right.
is it gonna be in our
The
budget?
town,
when-
I mean, I don't know. I
But
mean,
it's more,
we need to
it
fact
would be in
find.
the, well,
We need to understand the need, and then we need to understand the timing.
right, so that's you and Anita.
Anita, yeah.
Okay, with Heidi,
Oh,
okay.
wait a minute, I'm so confused. We need to understand timing for what? What is
For
our role?
loss of services, for loss of, so a couple things, for, loss of funding for existing services, and then is there a huge need that we're not filling, that we really should try to even advocate even beyond what we're
So the
doing?
food bank falls under youth and family
Yes,
services,
right, not
which
the Board of
is,
Health.
which is a select board
Yes.
department. There's no board that oversees
No,
it. So,
right.
I mean, you can advocate to the select board
Yes,
to support, you know
Yes.
what I mean? That
That's
would
right.
sort of be the path,
That's-
right?
that's
what
right.
I'm
Trying
like,
to get at.
we're
The
gonna add
path
it to
is
our line item.
Food insecurity,
Right.
that's the path.
that's right, because the
Yeah.
last thing was
Okay.
a letter to, to town manager, and that was years ago.
Okay, so
So-
that makes sense. We're not
Right.
doing anything beyond advocacy there.
Right,
Okay.
it's,
Yes.
it's advocacy. and that's
Yeah,
what
but I want to
put
find
there.
out about.
Okay.
And maybe space for the food bank. I mean, if you
Right.
wanted to
Yeah,
kind of
yeah.
participate in
Yeah,
those
whatever is
conversations,
needed, right?
maybe that would be a way to do it too. I mean.
And my recommendation on that one, because it really has morphed,
Yes.
is, if you and Anita can update the framework.
Okay.
Because it's more from just advocating that food insecurity is a public health need
Right.
to advocacy and space, which are specific Bedford
Yep.
needs.
Yep.
Ventilation, Maureen.
I'm
I
not
know-
gonna push that. I mean, that was an
Yeah.
interest in mine coming out of COVID, but it's low on the priority
Okay,
list.
yeah, I agree.
Okay.
Vector
David,
borne-
that was probably outreach to organizations in town that have buildings, churches, those kind of institutions, businesses, and just say, in the event of a new one, if you're doing your systems over, what are the,
Right.
what are the modifications that we would recommend, or CDC recommends at this point? Okay.
Okay, vector-borne diseases, I think that's just ongoing
Yeah.
at this point.
We are going to have, we have an opportunity to have a tick presentation here.
Oh,
From
great.
from the region.
Good.
With our epidemiologist as well as an
Yeah, yeah, yeah.
entomologist from the area.
Tick
All
We're
right.
also working to get either Katie or Matthew, who spoke last
Yeah.
time, to come and present. But it's gonna
Okay.
be with Kaylee, who's our new
Okay.
Good,
our
great.
regional coordinator.
Oh,
Nice.
And I've said regionally, yes, I want to do it here in the read room, and
Oh,
so.
yeah.
Okay, great.
We're looking at, I think we're looking at either late August or like then either middle or later in September.
Oh, that would be so
like,
timely.
yeah.
That would be awesome.
Yeah, so.
Late August, it's
Together.
hard to get.
I know, but no, very late, like literally like the last week in August, so that
Yeah, but
maybe
even
people
so, I
are
think
back.
With a
because
later,
school
with a
starts.
later, Labor Day this year,
Yeah.
late August is like 2 weeks before Labor
When
Day.
is school starting though?
Before Labor Day, I believe.
So I was kind of thinking about,
Yeah, it's before Labor Day, but because Labor Day is so late, so it's still in September.
okay.
It's that week before Labor Day
It's the
weekend.
beginning of September, it's like
Right.
September 2nd.
Yeah, I
something like
just-
that is the start of
all right.
school.
I would just advocate for September, even though it gets really busy, but, I think this, well, whenever it works, I guess. I'd be happy to help with anything that needs help in that,
Yeah.
because that's certainly an interesting line, so.
Yeah, and that
So
was
anyway,
both
it's
of
an
us.
opportunity to have the talk and then
Yes.
think about, I mean, there's that other topic as well about like just, I shared it with a couple of folks. It was the discussion about how we're controlling, how you can, you feed the deer
Oh, yeah.
something, you feed the deer something so that when the ticks bite the deer, it makes them, they lose their reproductivity.
Exactly.
Essentially, it's like birth control.
Right,
for
it's
the
birth control,
ticks, right?
yeah.
But it's not an application, it's actually you feeding it to the deer so that the deer then give it to the, but then we were asking, so we actually reached out to the state to ask, well, why aren't we doing this?
Yes.
Like if this has been studied,
Yeah.
and the answer was, there haven't been enough studies. So the DPH won't pick it up, it's actually a division of Fish and Wildlife
Yeah.
that has to do the work, so, I mean, and again, maybe then it becomes advocacy to them. Or our board, my consideration was, well, maybe the Bedford Board of Health reaches out to the boards of health in the other, I don't know, the regional communities or whatever, a part of the Great Meadows communities.
Right.
Maybe we have one letter, like we did with the Dr. Huda stuff, like
Yes.
one letter that we send from all of us to this entity that maybe influences them
Yes.
to put money in their budget to do this, I don't know, but again, I'm just thinking these are a couple of different avenues that we
But
could take.
If you want that, let us know, because I think that's something that we would support.
Oh, yeah, support and help with. Okay.
Yeah,
Yeah,
All right.
and help with, so
Right.
that.
And then you're gonna solve loneliness, right? Is she-
So.
All by myself, I put a name out there.
By yourself, there you go.
Yes,
You wanna
by
do it.
yourself.
One is the loneliest number, right?
Well, it's funny because I was going through my notes and I saw that I was interested in it, so I put my name down.
Okay.
But I'm happy to work with anyone on this. I did go to the session, as I mentioned earlier, at Ashby Place, and it's everywhere in town. It's a community issue, so I would welcome someone working on this with me and with Heidi, and because it's more than Board of Health as well. It's HHS, it's the schools, it's everywhere.
Mhm.
I mean, all of the hospitals recognize it as part of their health needs.
Yes, I know.
Their
Yeah,
community health
it's
needs
just like-
assessments. It's just like, what do you do? Like, so then it becomes like, okay, so how do we address it? We're having our whole area out here, our center, our roundabout here, area here renovated, which will hopefully make it a little bit more accessible,
Yeah.
thinking about, because we had the Happy to Chat benches there, but then,
Yeah.
I don't know, just think about other ways to kind of, areas that we can have in town to make things happen and maybe have little events or something.
So if anyone is interested, I'm just putting it
Never think
out
about
there.
that. Yeah, okay.
To public safety, gun and domestic violence, Maureen and I have been working on that for a while now. Maureen mentioned during Jackie's report, the amazing work Jackie is doing on a social media campaign, and
That we
Maureen-
all worked with her on to develop.
Yeah.
it. She
Yeah.
just flew with it and put it together, and she'll be the one responsible for putting it out every month,
Right.
so. I think when it gets closer, when that's gonna go out, we can bring a more detailed thing and put out examples
Yeah.
of what, send out to
100%, yeah.
board of health members, so for our next meeting,
Yeah.
what
Oh,
the,
yeah,
what
please.
the postings, what they are each month and whatever, okay?
Great.
The other thing on that, though, is advocacy, in that there is a movement at the state level to repeal some
The 2024 Massachusetts gun
gun
law,
laws.
which made us #1 in the country in terms of
Right.
what we were doing related to, I keep on forgetting what's it called, you report someone, the.
Red flag.
Yeah,
The
red flag, the red flag, ghost guns, all that type of thing. And so that's warrant Article 9. It's the last one, which is concerning because Right now, it's gonna be a very long ballot. And I
Yes.
think, are people just gonna get tired and not even get, so I'll talk about the next, but I would like to propose to Bedford Day, I'm happy to sit at a table and have information about this, you know.
Do you know if is that a binding or is that a non-binding resolution?
I thought it was
Yeah, I
binding,
need to-
that when I
don't
went,
know the
I'm
answer
going
to
to
that.
another meeting on
Okay.
it in August at, First Parish the Arlington Library with this, Grassroots for Gun Violence Prevention. They're having a speaker come in, and I got a copy of his book that goes through a lot of stuff, so I'll work on that. in the next
I
month.
really need to, because I know, Legal and Voters put out some information on all the
Yeah.
ballot stuff. I need to look at that.
Yes,
see if
and
that
they're,
has
and
that.
they are for this. They've already come out as
They're
against the repeal.
Against-
Yeah,
That's what's gonna be
repeal.
confusing
Yes.
to
Yeah,
people.
that's always,
Oh.
yes,
It's
that's
always
always the great
confusing.
thing.
So I think we almost, even if part of it is giving people cheat sheets, so they
Yeah.
go in with,
Yeah.
marked off or
We
something.
just have to figure out from a timing standpoint, because our next meeting isn't until after Bedford Day,
Okay.
No, I thought it was August,
only if needed.
because I thought somebody was coming in already in August. Oh, no? I thought there was like a planned, where did I read
No,
that?
think so.
that somebody was coming in August to present something to us?
Well, I'm
No?
happy to pull together something. I don't think the board has to approve it, because you and I
Right.
are always working on the framework,
And exactly, so in my question to everyone is, as part of our framework and what we've been doing, we've been advocating through the forum, through the buybacks, through the social media. Just if you're gonna have a gun, like, be responsible, have it locked. We don't want it to be used inadvertently or in a domestic violence situation, suicide attempt, or anything. Children. So I think as part of the framework we currently have, having Maureen or someone at Bedford Day just giving out the facts of what,
Yeah.
of what the ballot question is, I think that falls under that, but I want to
Yeah,
make sure
yeah,
everyone
yeah.
agrees.
I think so.
Because basically we're saying, right now our gun law, all of our gun laws is.
Right, you want to say, to be clear, vote no on this or vote yes on this, they give people clear.
Well, we
Well,
can
we
have the
want the-
facts.
I just would
Yeah,
give
the
them the
facts.
facts.
Right.
I'll come together
Of
with
what
the
it
fact
means.
sheet. Yeah, I think
And
this,
what does voting no or yes mean?
Mean.
right.
And
that's the
giving
thing.
people facts,
And
not
I-
necessarily taking a
No,
position.
right. The facts will be that the 2024 gun law has these provisions that the state has deemed is really important to keeping communities safe. And so if you want those things,
Right.
you gotta vote against repeal.
Yes.
But something very simple, but I think it's.
But I think it's facts, and
Yeah.
I think that
Yeah.
works.
Okay.
Human trafficking came up in a couple of different discussions. So right now, no one has taken that on. I know, Heidi, you were going to do some research into it.
Yeah, I mean, I've done a little bit of research, so yeah, I mean, it's of interest. It's like it kind of felt, I fit it in when I can for sure.
Okay. And I just wrote of interest.
Yeah.
And then other things that have come up,
Battery energy.
battery energy storage systems and data centers. There is a data center being considered behind Whole Foods, I believe.
It's a best site, not a
A
data
best?
center. Yeah, it's a best.
Oh, it's the best site?
It's small, it's a small.
What is it?
Battery energy storage.
Remember at the
MAHB.
MAHB at the end?
I didn't go.
Oh, that's right. Oh, there's problems with these sites.
Oh, of course, but so there's
fires
something
and-
being considered in our town?
Yes, a small
Yeah.
one. Yeah.
Uh,
Yeah, lots of towns.
They buy, they buy energy, they're essentially large battery packs, right? They buy energy.
I know,
they
but there's
buy
so
energy-
many problems with them.
Yeah.
What I will do is, I want to do some more research to really understand like what's involved and
Yeah.
what the public health implications are, and then maybe we can decide. if
I
we
mean,
wanna-
I mean, when you look at like, how involved does the Board of Health get in authorizing or taking a look at above ground storage tanks? These are large storage tanks, right? That like, you're not involved in that at all, by the way. Like, the health department, the fire department issues permits for storage. We, you know, if the plan comes around through initially, we're looking to make sure that there's just, that the required secondary containment is there, which is
Right.
110% of the capacity and such, but it's really a fire, for the most part, from what I can see, is a real
Fire.
chemical
Yes, it is, 'cause I
hazard.
live there.
But in
It's
the
just
article
like-
in the Citizen, Tony Fields was commenting on it.
Yeah.
And for the planning board.
Yeah,
So I'm trying to understand what their role is in that, zoning and planning.
yeah, I think it's about like appearances and like what it looks like, and you know, they have more of a, I get that there's more of a say, I guess, as to like, is it authorized to be in that area for, based off of our zoning, right, from a zoning
Right.
perspective.
So who is giving the permit to put, is there a permitting process or is it just?
That's what they're figuring out, I think, is like how it, there does have to be expedited permitting that
Expedited.
happens for it.
Per the state, there's expedited.
Okay, so I
permitting.
guess what we need to find out is what the process is in our town for these. And then we can certainly research, you know, what are health implications of having
Right.
best systems? And we can, again, write a letter just saying, you know, to whoever is permitting or in charge of this process.
Yeah.
Does the town have a veto power on them coming in or not? If it's on your property, can you put a best system up? I mean, as long as it meets certain criteria or, well, that's what I mean. So I don't know
Yeah.
that we can do anything on it right
No,
now.
I know, but it was just,
Yeah, no.
and that,
I think it's
and-
one of the things you keep our antennas up about this issue.
Yes.
And I think we all see it in the citizens, like, we all have that same gut reaction. The
Okay.
other is e-bike safety awareness. Again, just, it's a
Storage.
potential thing.
Also, well, the speed limits, I mean, you know, you see in the Bedford Citizen, how, you know, kids who are speeding, cops are starting to notice and, you know, trying to do something,
Speeding,
right?
and it's also even things, just the other day, I watched two kids on motorized scooters, which, and they were literally in the road with traffic.
Yeah.
Yeah.
These are not motorbikes, these are kids who are
Yeah.
definitely not of age to be driving them. And they were, two of them right in with cars and
Yeah.
cars behind.
Do-
And I
so
was
do
watching
we-
that on Springs Road, I
Yeah.
was like,
So do we have a conversation with someone in the police department about
I think.
e-bike safety
Yeah,
in
and I think
town?
the other thing is, that
Yeah.
if I recall, I think the state's working on some
State
regulations.
is working
because
on
of
a
that.
regulation.
Oh, good.
Because of speeds, there's a certain speed
okay, well,
cutoff
oh,
that
good.
basically it's like the rules change, but they're very ambiguous, I guess, a little bit
Yeah.
right now. And they're trying to basically figure out tightening them up because it's like, where's the cutoff of it's no longer a scooter and it's
Right.
actually a motorcycle.
Yes,
Yes.
yes.
So the state, I think, is working on some of that. I don't know where. it's
And the
going.
police have done awareness campaigns
Yeah.
as well.
Okay, all right, well,
An
again, on
outrage.
our antenna.
So, and everything else was COVID related.
Yeah.
So my question, and I apologize for running late today, we
Yeah.
covered a lot. And I'll turn to you, David. Is there anything we discussed that you would want to either take from one of us or get involved in?
So with these, I would say, I'd be more than happy to work with you on the loneliness
Okay,
part of that. And then, again, if I start, I'll keep an eye with the PFAS. I
Yeah.
can start
Yeah.
attending those.
That'd be great.
With
Yeah.
Massport.
Good.
And then, is there anything else? Is there anything people are like, I'm done with this, I need help for?
the only other ones that, again, are totally up to you, if you wanted to do something on communication or on the BESS and data center with Maureen. Just to research it,
Well, just on
Just
our
have
own,
another
if you
perspective.
just look at some stuff, yeah, I mean,
Yeah.
you know, whatever.
but totally your choice.
Yeah.
Yeah.
You've got with the RAB and everything, and now loneliness with me.
That's
I don't know about
huge.
myself.
That's huge. All right.
But, okay, thank you, everyone. And apologies, as I said, the last thing is minutes. And then liaisons.
I didn't find anything.
The only thing I had, page 3. The first bullet point under updates, discussion, instead of over health, overall health. See the first.
Where are
bullet?
you?
Sorry.
Okay.
Page 3.
Overall health.
Under
First
updates.
one.
I'm reading, I'm
Yeah.
going to over health. I couldn't figure out what it was. I
The
went
first
back
bullet
and looked
point
at the
should be
frameworks and then I
overall
got
Oh,
overall
Got
health.
it.
Yeah.
Yeah, the only, same bullet, moved, where it says move to climate change to,
Yeah.
move from.
Move from, yeah. Okay, okay.
Okay.
Otherwise, everything else looked great to me.
Yeah.
Yeah, very good.
Thank you again, Danielle.
Yes,
Yep,
thank you.
thanks.
Any other changes? With that said, I'll,
I
Accept a
move
motion.
that we close the, oh no, we're on this. I move that we accept the, I'm moving ahead of myself. I move that we accept the amended meeting minutes of June 15th, 2026.
I'll second it.
so moved by Maureen and seconded by Bee. All in favor?
aye.
I hear as well, so 400.
Okay.
And liaison reports, I actually don't have,
No, I'm
Yeah, I
not.
didn't have any.
anything else from anyone.
So we're definitely, unless something comes up, we're not having the August meeting. So Let
Correct.
us know if there's something that comes up. Okay.
So a motion to adjourn?
I'll do it this time. I move that we adjourn the Board of Health meeting of, what do we have? I just lost the date, July 27th, 2026.
Second.
So moved by Maureen and seconded by David. All in favor?
Aye.
Any denials? No.
Really won't stay.
You really want
Four
to
zero zero. Thank you, everyone,
Thank you.
and I owe you 30 minutes back in your day.
start.